Assalamualaikum warahmatullahi wabarakatuh. Good morning,
Waalaikumsalam warahmatullahi wabarakatuh.
good morning, guten morgen, ciao an, suprabat, and good luck to all of us. Welcome to the International Seminar of Health Polytechnic of Ministry of Health Jakarta 3, 20 and 23. The Honorable Director of Health Polytechnic of Ministry of Health Jakarta 3, Mrs. Yupi Supartini, SKP MSc.
The Honorable First Vice Director, Mrs. Sri Mulyati, SPD MKes.
The Honorable Second Vice Director, Mrs. Dr. Nima Dery Yasmini, SKP MKes SPCOM.
The Honorable Third Vice Director, Mr. Bagya Mujianto, SPD MKes.
The Honorable Head of Department of Nursing, Mrs. Dr. Pramita Iriana, SKP M Biomed.
The Honorable, the speaker who have attended as this international seminar, and the Honorable, all the lecturer and the staff of Nursing Department of Health Polytechnic of Ministry of Health Jakarta 3, and all participants of this seminar. Thank you for attending this event.
Before the event starts, let us to introduce ourselves. My name is Satrio and my partner
Royhana,
as Master of Ceremony of the International Seminar with the theme Aging Population, Welcoming an Era of Prosperous and Happy Elders, which was organized by the Student Association of Nursing Department of Health Polytechnic of Ministry of Health Jakarta 3.
First of all, we would like to remind the participant to fill in the initial attendance form given by the committee via chat Zoom or the YouTube comment column. Initial attendance form is open from 8 until 9:30 West Indonesia time. All participants must take screenshot while participating in the event to be uploaded on the final attendance form.
As initial information, we convey the schedule of the seminar consists first opening, second reading the rules of this event, third we'll be singing Indonesia Raya, fourth we'll be singing the march song of Health Polytechnic of Ministry of Health Jakarta 3, fifth we'll be receiving report from Chief Executive, six opening remark from Head of Department of Nursing, 7 chanting prayers, 8 the seminar will present with 3 speakers from Indonesia, Australia, and Germany, 9 ice-breaking and door prize announcement, and last documentation and also closing.
Next, allow me to clarify the participant rules and health protocol during this international seminar. First, participants must register on the registration link listed on the poster before October 21, 2023. Second, the certificate is only given for participants who participated from the beginning to the end of event. Third, participants must write their full name and title correctly on the registration form because they will be printed on the certificate. If there is an error in writing the name, the committee is not responsible for replacing it. Fourth, participants only choose one media provided between Zoom or YouTube channel the Student Association of Nursing Department. If there is a problem with the media provided by the committee, participants can contact the contact person listed. 30 minutes before the opening of the seminar, there will be an initial attendance form, which will be shared via chat Zoom or the YouTube comment column. And the participants are expected to fill out the form.
6 all participants are required to wear a polite and neat clothes. 7 if participants join via Zoom, first all participants must use their full name on the Zoom application _nation. For example, my full name is Satrio Danang Soleman Mahardika _Indonesia. If the committee doesn't recognize the identity of the participants, then the committee has the right to remove the participants from this event. Second, during the activity, participants are required to activate the video at the beginning of opening and at the end of this event. While the activity is in progress. And last, participants are required to take a screenshot when Zooming, and the photo is uploaded to the final attendance form, which will be distributed after the event is over. 8. If participants join via YouTube live streaming, first all participants must use their full name on their YouTube account. Second, participants who have used the YouTube account application are advised not to open the Zoom link for mutual convenience. Third, participants are required to take a screenshot of the presence of images and activities during live streaming on YouTube. And last, proof of attendance will be uploaded to the final attendance form, which is open at 11:30 a.m. to 1 p.m. West Indonesian time. And the form will be distributed after this event is over. 9. During the seminar, participants are expected to be able to listen to the material without making a fuss and are advised to take notes on the material presented by the speakers. 10. If the presentation process is ongoing and there are questions you want to ask, you can ask via chat Zoom or the YouTube comment column with the following question format: your full name, _ the speaker you want to ask, _ your questions.
Next, it is forbidden to use sentences that contain element of Sarah. Near of the end of event, participants are expected to fill the final attendance form that will be shared by committee. The last, attendance of participants will be monitored by the committee. Next, we move to online seminar hall protocol. First, participants are expected to set the distance between the eyes and the monitor, which is ideally safe is 5 until 100 centimeters. Second, participants are expected to sit up straight. And last, participants are required to use the virtual background that has been provided by the committee.
Ladies and gentlemen, the seminar participants who we respect, we will sing to the national anthem, Indonesia Raya, followed by the march song of Health Polytechnic of Ministry of Health Jakarta 3. So please remain straight and be ready.
Semangat sivitas akademika Politeknik Kesehatan Jakarta 3 berdasarkan iman dan takwa kepada Tuhan Yang Maha Esa, siapkan kualitas tenaga kesehatan berwawasan luas seluas jagat raya, meninggalkan bangsa. Tekes Jakarta 3 penelitian berkesinambungan, ilmu dan teknologi selalu dikedepankan, profesionalitas yang dijadikan andalan, tingkatkan daya hidup masyarakat Indonesia. Tekes Jakarta 3 Tekes harapan bangsa.
Next, we'll be hearing the report from the Chief Executive of Nursing International Seminar 2023, Bismil Hanifah. We're welcoming your report.
Okay, thank you for the MC. Assalamualaikum warahmatullahi wabarakatuh. Alhamdulillah, all praise to Allah Subhanahu wa Ta'ala who has given us the blessing and hope so that we can gather together on this occasion. And salawat and greeting are given to the Prophet Muhammad Sallallahu Alaihi Wasallam by saying Allahumma shalli ala Sayyidina Muhammad wa ala ali Sayyidina Muhammad. May we all be brought closer to His intercession. Amin, amin, ya Rabbal Alamin. First of all, I would like to thank here Director of Health Polytechnic Ministry of Health, Jakarta 3, Mrs. Siti Supartini, SKP MSc, here Deputy Directors 1, 2, and 3, Health Polytechnic Ministry of Health, Jakarta 3, and I respect Head of the Nursing Department, Mrs. Dr. Pramita Iriana, SKP Embiomed, and the Nursing Department Management Staff. And I respect to the Student Coordinator Majoring in Nursing, Mr. Adi Sudrajat, SKP MPOP, and what I'm proud of is the participant and committee of 2023 Student Nursing Association International Webinar who were willing to take the time to attend this event. Before that, let me introduce myself. My name is Bisma Hanifah, as the Chief Executive of the 2022 International Webinar event. On these occasions, I will report several things regarding the activities of 2023 International Webinar event. The 2023 Nursing Student Association Webinar International is a routine activity carried out once a year. This year, Student Nursing Association focused on discussing aging populations, welcoming an era of prosperous and happy elders. In order to provide educations, directions, and increase insight to the wider community about applicable technology in service for the elderly, and we also gain knowledge about the elderly in order to face aging populations. In this webinar, we are holding a Zoom meeting with registered participants who are approximately 700 participants. And I hope that the material presented by each speaker can provide knowledge to the participants who attend this event. I would also like to thank the committee who have contributed to organizing these events, starting from preparation and the inaugural meeting on Wednesday, 12 July to the today's event on 21st October 2023. That's all I can say, more or less. I'm sorry for that. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you, Bismil, for your report.
Next, the opening remark from Head Department Nursing of Health Polytechnic Jakarta 3, who will be represented by Secretary of the Nursing Department, Mrs. Indiana Rahmawati, SKP MSI MTD HE. To Mrs. Indiana, the time is yours.
Okay. Thank you for all the committee. Should I speak in English or in Indonesia?
You may speak in English, please.
Sebentar ya. Yes, thank you for our opportunity. First of all, our distinguished guests. I can see this in Zoom. Mr. Paulus had present ya. Good morning, Pak Paulus. How are you? Kangen juga ya, lama nggak ketemu. And ya, sama-sama. For Dr. Pukovisa, am I right? Ibu Miss Heni Silalahi and Miss Raden Siti Mariam, thanks for all your opportunity and your time to give us the material to share your experience to us, especially about elderly. In similar with this topic in this webinar. So I think most of the speaker will give us the very useful material to all the participants, especially for the student, to straight ahead to the elderly. Yeah. And all the lecturer, docent in Polkes Jati, all the committee, and all the participants in this webinar. Assalamualaikum warahmatullahi wabarakatuh. Good morning, happy weekend for all. First of all, I want to say apologize from our head of nursing major, Ibu Pramita, because right now she is out of Jakarta. Yeah, she's doing something with Uji Kompetensi Nasional, yeah, held in Surabaya, and because she is the leader of it, yeah. And on behalf of her, I will deliver this speech to open this webinar. And this is a very good opportunity for me. Thank you for the committee. From this topic, or I mean the theme of this webinar, we will know how to make our elderly to be happy and to be prosperous, yeah. And few of the speaker will say about dementia. So hopefully none of us will get dementia, yeah. But if we get it, or if our family get it, so we will know how to handle them properly. And from this seminar, I hope all the participants will know as individual and as role of individual, as a student role, as a team of the or member of the family, and as a health worker, especially on nursing, we know how to make our elderly be happy and prosperous, especially for someone who has dementia. And we know that in Indonesia, we have kind of what we call lansia smart, sehat, mandiri, aktif, produktif, and bermartabat. It means everybody should do something to make our lansia is smart, because nowadays the amount of lansia in Indonesia is almost, if I'm not mistaken, is almost 18 million, yeah, almost 18 juta, 18 million, and it's a huge amount, yeah. So hopefully from this seminar we got something, we get something clue, we got something to do, and hopefully we get some operational or some example, yeah, how to do with this kind of lansia or elderly, yeah. And at the end of this speech, I will special thank you for our speaker, to all the participants, to all the colleagues, to all the committee and the lecturer who have attend this webinar. And on behalf of nursing department, I'll deliver the thank you for all, and so sorry if all this occasion there's something that make you in uncomfort. So that's all, I think. Thank you for all the participation. Thank you for all the attention. Assalamualaikum warahmatullahi wabarakatuh. Good morning and happy webinar.
Wassalamualaikum warahmatullahi wabarakatuh.
Thank you to Mrs. Indiana for your wonderful speech and also opening.
Before we continue to the main event, let's pray for a moment which will be led by Muhammad Vito Rizky Rubianto. To Vito, time is yours.
Assalamualaikum warahmatullahi wabarakatuh. Allow me to lead the prayer according to Islamic law, for other faiths can adapt. A'udzu billahi minasyaitonir rajim. Bismillahirrahmanirrahim. Hamdan syakirin, hamdan na'imin, hamdan yu'afi ni'amahu wa yukafi masidah. Ya Rabbana lakal hamdu kama yanbaghi li jalali wajhikal karimi wa azimi sultani. Ya Allah, our Lord, all praise to you, sustainer of the universe. All praise for the gift and pleasure that you have bestowed upon us. All praise for your majesty, your glory, and your power. Ya Allah, Ya Rahman, Ya Rahim, Lord who rules this universe, there are no words that we should say but the highest praise for you. Because it's only with your authority and permission that this morning we can gather in this framework of the international seminar. Therefore, unite our heart, combine our steps, and grow a sincere feeling and friendship. Keep our soul in purity and decorate our moral with exemplary of Allah. Link the rope of love between us so that we can respond to differences beautifully and also make the event on this day as an act of worship, as a symbol of togetherness, strength, and unity, to build the land we love based on faith and pity. Ya Allah, Ya Rahim, in this event, we will hold an international seminar with the main theme of aging population, welcoming an era of prosperous and happy elders. Therefore, we ask you for the smoothness and blessing of today's event. Ya Allah, we also beg you that this event can provide benefits and that we can apply the knowledge. Allahumma salli wa sallim ala Sayyidina Muhammad wa ala alihi wa sahbihi ajma'in. Asyhadu an la ilaha illallah wa asyhadu anna Muhammadar Rasulullah. Ya Rabbana, Allahumma arinal haqqa haqqa warzuqna ittiba'ah wa arinal batila batila warzuqna ijtinabah. Rabbana atina fid dunya hasanah wa fil akhirati hasanah wa qina azabannar. Ya Allah, our Lord, grant us happiness in this world and in the hereafter, and save us from the torment of your hellfire. Wa sallallahu ala Muhammad wa ala alihi wa ashabihi ajma'in. Subhana rabbika rabbil izzati amma yasifun. Wassalamun ala al-mursalin. Walhamdulillahi rabbil alamin. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you, Muhammad Fito, who has led the prayer today.
Next, we enter the main station of this event. The theme of the seminar today is Aging Population, Welcoming an Era of Prosperous and Happy Elders. And the first station will present first speaker from Indonesia and Australia. The delivery of all material, question and answer session with the speaker will be guided by Mrs. Puspita as a moderator in this session. Before we continue, let's get to know to our first moderator. She is also known as a lecturer at Health Polytechnic of Ministry of Jakarta 3. This is her curriculum vitae. Her full name is Nurse Puspita Hanggit Lestari, MCUP, SPCUP, Com. She is born at Jakarta, 20 February 1988. She is a coordinator. She is a coordinator of the International Class Bachelor of Applied Nursing at the Health Polytechnic of Ministry, Health Jakarta 3. She is graduated from Indonesian University, Faculty of Nursing. She get a community nursing specialist at 2018. She has a research experience from 2019 until 2023 for the newest one. She do a research about community-based health services for elderly people with hypertension at the primary care level systemic review. For now, she is a lecturer at Health Polytechnic of Ministry of Health Jakarta 3. And she is incorporated at Ikatan Perawat Kesehatan Komunitas Indonesia or IPKKI at DKI Jakarta.
How great, yeah?
Yes,
That's
I know.
Great.
Let's greet our first moderator, shall we? Mrs. Puspita, are you ready for today?
I'm sorry, Miss Puspita, your voice. We can hear your voice. Okay, now maybe.
Nah, padahal udah aku. Hello everyone.
Hello.
Hello, Miss
Hello,
Fusda.
Miss Pupita.
Are you ready for today, Miss?
Okay, I'm ready.
Okay.
That's great.
Yeah.
Okay, Miss
Can
Fusda.
you hear my voice clearly?
Hello.
Yes, clear, Pupita.
Okay, thank you. Okay. Assalamualaikum warahmatullahi wabarakatuh. Good morning. Hello everyone, the participant of this international webinar. Okay, I'm Puspita Anggit Lestari. Please allow me to lead the first session in international webinar. The Honorable Director of Poltekkes Kemenkes Jakarta 3, the Honorable the Head of Nursing Department of Poltekkes Kemenkes Jakarta 3, the Honorable Secretary of the Nursing Department, the Honorable Head of Bachelor of Applied Nursing Study Program and the Head of Diploma 3 Nursing Study Program, and the Honorable Student Affairs Coordinator, and of course, all of the participants in Zoom meeting this morning. Okay, thank you for giving me the opportunity to lead the international webinar for this first session. Okay, for information on this first session of the international webinar, there will be two speakers, Dr. Pukofisa Prawiroharjo, specialist neurologist, subspecialist NGD, PhD, and Nurse Paul Malau, RN, BN, MN. We will divide this session into two sessions for each speaker. And in each session, there will be a presentation for 35 minutes and discussion session or question and answer session around 15 minutes. So for the participant who want to ask question, you will ask in discussion session, and you can use the raise hand feature or write your question in the chat room. Okay. For the first speaker, we will have Dr. Pukofisa. Hello, Dr. Pukofisa.
Hello. Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone.
Okay, good morning, Dr.
Waalaikumsalam warahmatullahi wabarakatuh.
Okay, so happy to meet you through Zoom today.
Thank you.
Dr. Pukofisa will explain about recognizing the difficult behavior of elderly in people with dementia. But before we start the presentation session from Dr. Pukofisa, let me introduce him first. I will read the curriculum vitae. Please, committee, share the screen. Okay. Dr. Pukofisa Prawiroharjo, Specialist Neurology, Subspecialist NGD, PhD, SH. Ya. Okay. Dr. Pukofisa lives on Jalan Rawa Selatan, Johar Baru, Central Jakarta. And if you want to contact or corresponding with him, this email address pukofisa@ui.ac.id, and this is the phone number of Dr. Pukofisa. For the background education, Dr. Pukofisa, Bachelor of Medicine at Faculty of Medicine, University of Indonesia, graduate from Medical Doctor at Faculty of Medicine, University of Indonesia, Neurology Specialist from Faculty of Medicine, University Indonesia, and Subspecialty of Neurobehavior, Movement Disorder, Geriatric, and Degenerative from College of Neurology, Indonesia, Doctor of Philosophy, Graduate School of Medical Science, Kyushu University, Fukuoka, Japan, and Bachelor of Law from Universitas Terbuka Indonesia. Okay. And for the fellowship and certification, Dr. Pukavisa certified of international person assessor, certified of international trainer, fellowship, International Society for Quality in Healthcare, and certified of mediator and conciliator. Okay, there are several working experience, but the newest one, Dr. Pukavisa is working in Department of Neurology, FKUI, RSCM, RSUI as a lecturer and medical staff from 2008 until present, and working in cluster Bioetik IMERI FKUI as a chairman from 2022 until present, working in Madaya Royal Hospital Puri, Abdi Waluyo Hospital as a medical staff, Medical Ethical Honor Board, PBID, and working as a researcher at Kyushu University, Fukuoka, Japan. Okay, and there are several books published from Dr. Pukavisa. Okay, Dr. Pukavisa have been achieved several awards, such as Satya Lencana, Budi LN LPDP Scholarship, Takeda Science Foundation Scholarship Awardee, Hibah Putih Q1, Hibah Putih Q2, Hibah Riset Green Prize, Mentorship OIM FKUI, dan UI Incubate. Okay, and then there is a lot of publication, 95 journal publication, and then 8 poster in national or local conference, 15 poster in international conference, 31 intellectual properties, over 100 symposium, seminar or committee that has been followed and implemented by Dr. Pukavisa. Wow, there are many achievements and experience from our speakers today. Okay, Dr. Pukavisa, you have 35 minutes for your presentation. Do you want to share the PowerPoint by yourself, or do you prefer be assisted
I
by?
prefer to share by myself, so I'm not repeating the slide. So I just,
Okay.
automatically change the slide by myself. So maybe it's preferable also for the audience.
Okay, thank you, Doctor.
Dr. Pukavisa, the time is yours.
Okay, morning everyone. Assalamualaikum warahmatullahi wabarakatuh. For the big family and honorable nursing program or department or study program at Polkes Jati ya. Polkes Jati ya Bu ya. Jakarta 3 ya.
Yes.
Okay. Thank you for having me as the speaker. It's an honor for being appointed and could share with all of you. Sorry. Sorry for the technical problems. Yeah. And then I will share to you about the difficulty, and maybe we can also discuss for the nursing approach for the dementia patient which has the behavioral problems and also in elderly. Okay. The first is we know that the incidence of the dementia is getting higher and higher, especially from the data of the WHO and other developed countries, and also developing countries. But in Indonesia, the problem is the case is not so well for the findings, yeah, in the community, because we do not have any movement from an special arrangement or fundings from the government also, and lack of funding and awareness also from the other parties such as philanthropies and etc. Yeah, so that yeah, the ideal for Indonesia is we should have the movement of screening the dementia. Because of what? The dementia is not like a heart attack. If we have a heart attack, there is a feeling of getting die, yeah, from the patient. So the patient will soon go to the hospital and emergency ward, yeah, because of the feeling of getting die soon, because of the heartache and also the pain and the shortness of the breath, yeah. And also compared with the stroke, yeah, the stroke, the symptom is very clear. The patient getting weakness, yeah, on the one side of his arm and leg, yeah, and he will by reflex, he will seeking the help in the emergency ward, also in the hospital. But for the dementia, yeah, the patient doesn't even realize that he is sick, yeah, that he is having the problem. Mostly the dementia patient or the demented patient, the patient reject reject about that he has the forgetfulness or other cognitive problems. Yeah. He even don't want to be brought, yeah, from the families to go to the hospital. Yeah, he reject to go to the hospital by the family. Even the patient angry to the family if his son or his daughter would like to help him to meet the doctor for dementia. Yeah. So the problem of dementia first is the ignorance, yeah, of the patients. Sorry, not ignorance. The bad insight from the patients. Yeah, that is rejecting that he is sick. The second challenge is there is an ignorance of the family. Yeah, mostly the demented patient come to the hospital because the family getting getting annoyed because of the patient's behavior, such as if the patient is wandering, yeah, and knocking every doors or geratak-geratak dapur begitu ya, kitchen, etc., and makes it at the midnight. So many of the so the son or the daughter cannot sleep because of that. That's why the time of point that the demented patient come to the hospital. But the problem is with this kind of symptoms, the dementia has been already advanced. Yeah, and we know that the dementia is the condition of the brain cells and the synapse of the brain is getting loose and loose. Yeah, the death of the cells is progressive. So that if the condition at that kind of advanced stage, such as like we have like a bank account, yeah. So we have bank account of the brain. We have like 80 billion of cells, yeah? About 80 until 100 billion of cells, neuron, yeah. And if the decrease of our bank account from 80 billion to 70 billion, 60 billion, etc. But for the advanced stage, such as we have already discussed, when the demented patient come to the hospital because of the family getting annoyed of his behavioral, yeah, the bank account of his brain cells is maybe about until 10 billion only. Yeah, so it has been decreased 1/8, yeah, from the ideal bank account of the brain cells. Yeah. So it's very advanced. So the challenge is if we have that kind of dementia patient in our clinic or hospital that has a very late stage and has already had the BPSD or behavioral psychological symptoms of dementia, the doctor could not do many things. Yeah. Due to the very, we have the brain plasticity, but because the bank account is only 10 billion, about 10 billion. The flexibility of we are doing the cognitive modulation or cognitive stimulation, cognitive restoration, even the drug, there were no so much benefit. So the problem is we should find the case as early as possible, and it should be like a program or movement, to prevent the patient from the very lack of the bank account of his brain, to go to the hospital. Maybe if I would like to, maybe I will stop share first. I will give you the pictures, or maybe I just ini kelihatan nggak ya, by the way?
Not yet, dong.
Not yet, Doc.
Okay. Sorry. Minute. So if I would like to draw, so this is the like the scale, This is like the cognitive level, cognitive. Sorry. Wait. Okay. Why? Cognitive, This is the cognitive level, and this is time, So many of this is like a normal aging, and that's many of the demented people is considered or believed as a normal aging from many of the communities in Indonesia. This is like a normal aging. For the dementia Alzheimer's, it will be like this. The graphics will be like this. Okay. The problem is because the lack of awareness and also the bad insight from the demented patient, and there are no movements from us as the medical or the healthcare professionals, then many of the patients come to the hospital in this spot when he has severe enough behavioral problems that annoy the family. That's the problem. So if we do have like doing the cognitive modulation drug, etc., we can only use this because the drug, the drug purpose is and the cognitive modulation purpose is how to make small level of improvement, but then we provide the decline is as the rate is as normal as possible, the rate, so the level of the rate level. So we know that in the normal aging, the cognitive is also decline. So there is a nonsense argumentation if the dementia care target is to make the cognitive back to normal, because the normal is also declining. Okay, so you should keep in mind that the normal situation or normal aging is also declining. So what is the purpose of the treatment of the dementia is to make the cognitive decline rate, or cognitive decline speed as same as the normal aging. Okay, and a slight improvement at the beginning. So we can only do like this if we find the patient in our clinic, in our hospital is come at this level. Okay, but if we find the patient at more early level here, yeah, all of the treatment and the care will be like this, okay, yeah, or very near with the normal decline rate. Yeah, so that's why it is important for us to have this kind of awareness, and it's an honor for me to share it with you. Yeah, so I believe that yeah, from my speech, I want all of you to have this kind of mindset that it is our responsibility as the healthcare professional to find the case in the community. Yeah, and if we see and observe the research with the community base, such as has been done from like Unpad, yeah, Padjadjaran University, Dr. Anam Ong and his colleague, yeah. Dr. Anam Ong find the Jatinangor population of elderly, about 50% of them has already been dementia. Yeah, mostly in the mild level. Yeah, some of them is in the severe level. Yeah, so from these numbers, yeah, if it is represent to all of the Indonesian, so we could predict 1 of 2 of our elderly population has dementia. Yeah, but why that many of the elderly not complaining, or his family also not complaining about the cognitive problems? Yeah, that's the problem of ignorant and the low awareness of from us as the healthcare professional also. Yeah, so that's maybe my I would like to give you this mindset. Yeah, it's our responsibility to find the case in the community as early as possible and treat them as early as possible with the medication, yeah, with the drug, with the every cognitive modulation and stimulation. Okay. Okay. Next, we back to this slide. You can see the slide, right? All of you? Yeah. Kelihatan ya?
For the slide.
Okay. So the dementia is getting higher and higher. Yeah. About 60% of whom live in low and middle income countries. Incidence rate is what, 10 million new cases per year, yeah, including Indonesia. Yeah, and dementia in elderly accounts for 60 until 70% of cases of all of dementia. That's the highest dementia in type of the all of the population. Yeah.
Dr. Bukovisa, we cannot see your PowerPoint.
Cannot see.
Yes.
Jadi stop dulu. Ini jelas ya? Clear enough ya? Okay.
Yeah, enough.
Okay. So the Alzheimer's is about 60 until 70% cases of all of dementia, and it has a huge population. Yeah. WHO, CDC, sorry, not CDC, NIH, and many of the developed countries count the dementia as the cause of death, yeah, in the 7th rank. But in Indonesia, it's not. Why? It is a fault from, it's a mistake from the doctors, yeah, that they wrote about the cause of death of the patient is due to the illness or disease that has the highest impact at the latest time of his death. Yeah, that's the problem. That's why in Indonesia, the record of the dementia as the mortality cause is not even in big 50. Yeah. Yeah. But in global, the dementia is ranked in 7th. Yeah. This is about the mistake. So if we have like the dementia patients, the cause of death is dementia itself, because we maybe take a note the dementia patient into the cause of death is like a sepsis or severe infection or several cardiovascular events, because of the dementia has low awareness of compliance of taking the drugs, yeah, has also low insight of take care of himself, yeah, their selves, yeah, about the personal hygiene, yeah, about the personal health, yeah, about the personal activities, yeah, all of those insight is getting impaired. That's why the dementia patient, yeah, doesn't care anything about him. So that why the leading at the later stage, yeah, the dementia will get infection, get sepsis, yeah, get cardiovascular event because he often forgot about taking the pill, taking the drug, and etc. Yeah, so that's why the dementia should be written as the cause of death. Yeah, not the sepsis anymore and not the cardiovascular. If we have the notification from the family whether the patient has forgetfulness or dementia before, yeah. And the impact is the dementia caused huge economic losses due to the more complex drug, more complex advanced care, yeah, more complex nursing care, yeah, that has the much cost about developing the facilities, yeah, much complex that and about the job loss of job, about maybe at least one of his child, yeah, because he need one caregiver, yeah, one caregiver. So maybe if he had 3 child, yeah, maybe one of his son or daughter will then leave his job, yeah, due to the obligation to take care of his father or mother, yeah. So all of those problems is calculated as the cost, and in America, yeah, and WHO also released this report that economic losses is predicted about 1.3 trillion US dollars, yeah. Okay. So the dementia is very huge problems, yeah. And for the behavioral problems, there are so many behavioral problems. There is a sleep disorders, eating disorders, wandering, yeah, aberrant motor behavior, disinhibition, agitation, aggression, yeah, elation, and mania, yeah. There's so many wide range of behavioral and psychiatric symptoms of dementia that will lead to poor quality of life, of course, yeah, not only for the patients but also for the caregivers and family, due to the obligation there. They will leave the job, they will leave everything, they will get angry, they will get mood problems, yeah, because of the agitation or the other behavioral problems from the demented patients, yeah. The second is of course the decrease of cognition that is associated with increased mortality, yeah, and decreased cognition as the global things. And the other is the cost, yeah. And the symptoms is has the various symptoms, from the emotional disorders, delusions, yeah, perceptual disorders, impaired motor function, circadian cycle disruption and sleep disorder, and also eating disorders. So the patient is the patient will get anhedonia or doesn't have any energy or motivation for doing the hobby, yeah, for doing the something that he like, yeah. And then somatic expression also, there is many psychosomatic of the depression, such as like a GERD, yeah, or the headache, or myalgia and etc. And dysphoria also. The second emotional disorders is apathy or motivational disorder, that the patient has reduced of goal-directed behavior, such as the hobbies, or such as if he would like to finish the project, in terms of 1 or 2 years, and etc. The planning, etc. Cognitive activity and emotion. And then the third is elated mood, from the hypomania until severe mania. That is a sustained and excessive feelings of well-being, cheerfulness, euphoria disproportionate to situation, which associated with the emotional tone that is increased or the emotional activity. The irritability, the excessive feelings of discomfort in response to feelings of threat and preparing to perform aversive attitudes of actions, that is compounded by hunger, drowsiness, and pain also. So there is so many small things that make him irritable. Affective or unstable mood, that the patient has rapid emotional changes within seconds or minutes that makes the caregiver is very confused about this situation. Then the delusion itself could, the patient has the false beliefs, and it is belief, so it could not be corrected, whether the son or the daughter or the other families of the patient would like to correct the false belief, it could not been done, because it is like a belief, it's like a faith, like beriman lah begitu keyakinan yang kuat begitu strong beliefs. So it is like a false belief that strongly held from the patient, and it is uncorrectable, enduring and irrefutable. Also, the beliefs could consist of the suspicion, whether the patient have a suspicion of his wife or his other family that will do negative things to him. Also conspiracy, whether he feel that other people will have a conspiracy to make negative things about him, to him. Feeling abandoned, worthless, persecution. There is also a subgrass delusion that he feels that the spouse are the impostor or the would like to make criminal things to him. And also the perceptual disorders that has in every sensory modality, from the hallucination, visual, auditory hallucination also. There is also like a visual hallucination dementia as the core features for the Lewy body dementia. Usually the visual hallucination is object or person, is clear object or person, that like animals and people that could be described in detail from the patients.
Dr. Pugovisa, I'm sorry, the presentation time is available only 10 minutes more.
Okay. Motor retardation, agitation, hyperactivities, and also the sleeping problems, eating disorders, sleeping paralysis, including the changing of the period, because the disorientation of distinguishing between the morning and night, etc. There were so many therapy of this, from the pharmacy, reviewing the drug, that whether they have like neurological side effects and drug interaction. So there are so many pharmacological therapy, maybe, because this is like a nursing program, I will just briefly stated that this is like anti-dementia that would also improve the cognitive, but also the behavioral changes. There are so many type of anti-dementia, such as written here. There is also antipsychotic that we should start low, go slow, but please to also observe the potentially adverse effect of the drug, whether there is like a typical and atypical type of the antipsychotic. And This is the recommendation from the guideline, but please also assess the adverse events such as like it could lead to death also. Yes, cerebrovascular adverse event, prolonged QT interval of the heart and arrhythmia, sedation, yeah, and also from the typical adverse event antipsychotic, there will be extrapyramidal symptoms. Yeah. From the atypical, there were such as weight gain and metabolic syndrome, yes, some of seizure, and pneumonia or deterioration of cognitive performance from if we provide the drug in long term. Yeah. So this is like the things that we should take care because it could lead to death, yeah, due to the prolonging QT interval of the heart problems. And orthostatic hypotension also could lead to death because the patient will fall down and getting severe trauma. Yeah. So those are the drugs and the side effects that should be monitored. Yeah. The evaluation is should be on 4 until 6 weeks. Yeah. Not rapidly because in geriatric or other patient there is some hemodynamic or aging problems that should be very slow to monitor. Yeah, we could reduce or withdraw when the titration until stop. Yeah, if there's no significant response or if the symptoms is getting resolved. Yeah. But if symptoms reappear, we could try it again, yeah, 2 until 3 times per month, yeah. This is also the antidepressant. There are so many types of it, yeah, but also the same with the antipsychotic. We should take care also not only the indication, but also the adverse event, yeah. Those are the dosage, yeah. Benzodiazepine, but please do not give this if it is not an indication for, yeah, because the general rules is we should prohibit the benzodiazepine for giving the patient in elderly patient because it increase the fall of risk and the cognitive deterioration. Yeah. So, but we could have this benzodiazepine in short term for the agitation, yeah, until the core drug or the nursing could take care of it, yeah. So those are the adverse effects that should be also be monitored, yeah. Yeah, this is the we can have like first choice is lorazepam. That anticonvulsant also had as the solution of the PTSD. Other drugs such as melatonin for the sleep problems, dextromethorphan, nazocin for the agitation, methylphenidate. Yeah, there are so many drugs. Even the cannabinoid, which is still illegal in Indonesia, ginkgo biloba for the cognitive problems. Yeah, but we should also assess the pharmacokinetic and pharmacodynamic changes of the drugs given. Yeah, we should also see or observe the renal function, the kidney function, or the liver function also, because it also all the drug will metabolize in those organs. Yeah, yeah. There's so many things about the drug should be considered. Yes, so it's not a simple works to considering drugs, yeah, and observe the adverse effect. Yeah. So many aspects of it. So we come to the non-pharmacological treatment. We could have like a cognitive stimulation, intervention, and rehabilitation. We could also managing delusion, yeah, for the yeah, we could discuss it from the nursing approach about the delusion and how to communicate with the delusional patient. And there are so many therapies, yeah, sorry, the occupational therapies such as symptoms, yeah, And aromatherapy, massage, light therapy, sensory stimulation also could help. The sedation therapy, pet therapy, yeah, whether it's alive or robot, yeah, reminiscence therapy, music therapy, outdoor comedy, yeah, exercise therapy, and etc. Yeah. So maybe that's all from me, and I will give it back to Ibu Puspita. Thank you for the attention. Assalamualaikum warahmatullahi wabarakatuh.
For explanation or sharing about your experience about elderly with dementia. Okay, now we will open discussion session. Does anyone want to ask in this Zoom meeting? Please, the participant, raise your hand. Or you can write your question in chat room. Okay, what an interesting explanation, yeah, from Dr. Pukofisa. It will increase our knowledge about dementia in elderly. We know that dementia will give main change, yeah, in elderly. It can make loss of function of cognitive behavior disorder. Okay, anyone want to ask? Oh, okay, there is a question. The first question is, to what extent can we ensure that difficult behavior in the elderly with dementia truly stems from the dementia condition itself and not from other external factors? Maybe Dr. Pukofisa can answer this question.
Yeah, thank you. So if the patient had already diagnosed as a dementia, yeah, we should prioritize, or we should make that the behavioral problems is come or stem from the dementia. Yeah, due to the cognitive awareness has already deteriorated, and also many of the symptoms that is come from the dementia. That's why the drug of choice, if we have the patient with the dementia that in the later stage he had the difficult behavioral problems, the anti-dementia drugs will help. It will assist this quality of life. Yeah, so that's why and it's like a global things here. We know, but we also not ignore the social or educational problems as the maybe like a provoking factors, or like other risk factors that could also play a role about the development of the behavioral problems in the dementia patient. But overall, we should think that it has also association with the dementia, and just observe when we give the patient anti-dementia, maybe given the higher dosage, yeah, and we could also how far or how further that the drug will help the patient. If the drug is not so good or in controlling the behavioral problems, then we can think about giving the other drug. Yeah. So that's the like a core thinking about the behavioral problems that develop after the dementia has already been established. Yeah. So we should think that it is stem from the dementia until it is proven otherwise.
Okay, I think it's enough explanation from Dr. Purwopisa. Okay, there is the other question from Catur Saputra Setiawan. I want to ask, what can we do if one of our family member has dementia? What help can we do to prevent the dementia from getting worse? And also, how do we approach that person when we want to provide help to that person?
Yeah, thank you. So we should screen all of our family that has already elderly or has the risk factor of dementia, yeah, such as like a previous traumatic brain injury problems, yes, other vascular risk factors such as like after stroke and etc., including if our family members has already been elderly in the age, yeah, maybe age 60 or more, yeah. We should do the routine, yeah. If you are the healthcare professional and you have your family elder patient, it is very late if you realize the patient has already dementia. The vision is you should screen the cognitive from the beginning. Whether it's still good, okay, nice, yeah. Then you should do the routine screening maybe every 6 months, yeah. And if the score has deteriorated, yeah, that's the point that you should bring him or your family to the hospital or to doctors to have the complete or complex assessment of the dementia. Yeah, that's how we should do. Yeah, but if the patient has already or our family has already established as dementia, yeah, you should communicate to the doctors, yeah, to the physician, whether there are so many cognitive activity and modulation that is suitable for the patient. It is not easy to answer this because the cognitive stimulation or activities should be made considering the cognitive capacity of the patient. So it's such a like a different task or different workforce, different worksheet. If the patient is already advanced stage, or maybe the same mild stage of dementia, but one patient had severe deteriorated in memory, but other patient had a good memory, but severe deteriorated in other cognitive aspects. Yeah. So there are so many cognitive domains should be assessed, and from all of those cognitive domain that has been assessed, we then formulated the cognitive activities based on the situation or the clinical signs of the patient. Yeah, that's why your task is to communicate to the doctors. Yeah, asking the doctor what kind of activities that the patient still have the capability of that and could stimulate or prevent the dementia is for getting worse. Yeah, because it's like a tailor-made. Yeah, it's not like a gross apa namanya, bukan baju grosiran ya. It's like a tailor-made ya. Ya, satu demi satu, one by one case is different approach of the cognitive stimulation.
Okay, thank you for the explanation, Dr. Purwopisa. So we have to do early screening, yeah, and then to make sure we have more assessment, yeah, and maybe we have to getting help doctors or another. Okay, I think it's clear enough for today, and for the time is already end. Okay, so we will closing this session. But before we closing this session, maybe Dr. Pukavisa, can you provide a closing statement for today's discussion?
Yeah, thank you, Bu Puspita. So my last statement is we should have like a three love of dementia. Yeah, the first is loving our profession, yeah, as the healthcare professional that has boundaries of ethic, professionalism inside the profession. That part of it is the moral obligation for us to find the case, yeah, such as this dementia as early as possible and treat the case as early as possible, and also to avoid the public perception whether the dementia is such like normal aging. Yeah, this is the first love. The second love is to love the patient. Yeah, love the patient. Love the every things and also address every demand or every things that could help or assist him. Yeah, due to the comprehensive care or the all of the complexity of the care of the patient, from the nursing, yeah, from the medical parts, yeah, from the drugs, etc. Yeah, so we should assist him as advanced as possible, as further as possible, yeah, about all of everything that we could provide from him, including the law problems, yeah. Maybe from the dementia patient, we ask the patient to have like a representative, yeah, to taking care of his money, his asset, etc. Because the dementia patient is prone to be criminality, yeah, financial criminal, yeah, because his insight about taking care of money, etc., is getting deteriorated, yeah, due to the dementia. So including the law problems, yeah. So we should assist the patient to have the like a law notes, yeah, from the notaris, yeah, from the notaris to have the personal representative of him. Yeah. The third is loving the caregiver. Yeah, because dealing the dementia patient is not easy. Yeah, it's like a very emotional and very have like a big burden for the caregiver, including the psychological aspect, yeah, emotional problems, yeah, lack of sleep, yeah, and etc. Yeah, deprived of sleep, etc. So we should ask and validate their emotion. Yeah, we giving him the caregiver tips and how to manage the patient. Yeah, and including them from every decision that we made, yeah, as a nurse and also from as a medical professional. Okay, that's maybe from me, Bu Puspita. Thank you.
Okay, so we have to give three love, yeah, three love for dementia with elderly. Okay, so this is the end of the first session with Dr. Pukavisa, but please stay on Zoom, Doctor, because the committee will provide a certificate first. Thank you for your sharing knowledge and information for us related to elderly people with dementia. Okay, I will return this session to the Master of Ceremony.
Thank you for Dr. Bukovisa for your shared wonderful knowledge and experience to us.
The next is symbolic awarding of certificate to the Dr. Pukovisa, which will delivered by the moderator, first moderator, Mrs. Puspita.
Okay, where's the certification? Yeah. Hello, Mrs. Indri. Are you there? Okay. Maybe Mrs. Putu, are you join the?
Just minute, maybe Bu Indri.
Okay, we will wait for Mrs. Indri. Mr. Aceh. Hello, Mrs. Indri.
Hello. Am my voice clear?
Yes, clear.
Okay, thank you. Dr. Pukovisa, thank you so much. Thanks for all the information, our big appreciation to you, because we know that we have to do something with this difficult behavior. Actually, I face myself in this condition, and for me, it's really hard. Even I'm in for the health officer as well. So on behalf of our major of nursing, head of major nursing, we deliver the certificate for you and we proudly present it to you. Hopefully we can make some agreement, or you can help us in later, yeah, Dr. Pukovisa, ya, because yes, thank you so much, because elderly is our vision. So actually a lot of material or a lot of program we perform for this elderly. Hopefully you can join us or you can help us, Dr. Pukovisa.
Sure.
Please accept the certification.
Okay, thank you, Bu Indri.
Yeah, you are welcome.
Okay, thank you, Mrs. Indri and Dr. Pukovisa. See you later in the next event, maybe. Okay, we will go to the second session. Okay, for the second session, we have Nurse Paul Malau. Hello, Nurse Paul.
Yes, speaking. Yes, I'm here.
Okay, how are you, Nurse Paul?
Very good, very good. Thank you.
Okay.
Am I the next speakers, or I'm the third speaker?
You're the second speaker, Nurse Paul.
Oh, okay, all right. Thank you.
Are you ready?
I just I thought I'm the third speakers, but anyway, thank you very much, as Bu Puspita. First of all, I would like to thank Student Association for the. Can you hear clean? Can you hear me clearly? Yeah.
Okay.
First, yeah. First of all,
I'm sorry, before you start the presentation, maybe I will introduce you first to the
Okay, thank you.
audience. Okay.
Thank you.
For the second speaker is also the great speaker too. We have Mr. Paul Malo, RN, BNMN. Mr. Paul today will sharing topic about elderly health service through digital health. Okay. And for the curriculum vitae, Nurse Paul have graduated from Diploma of Nursing at Academy of Nursing, Department of Health Republic of Indonesia, Jakarta, and then graduate from Bachelor in Nursing for Avondale College, NSW Australia, and then graduate from Master of Nursing from Avondale College, NSW Australia, with major cancer nursing. And present position, Nurse Powell is a clinical nurse consultant, apheresis, at Royal Prince Alfred Hospital, and he lives on apheresis unit level 7 West, Royal Prince Alfred Hospital, Australia. Okay, there are several working experience. Mr. become academic staff at Academy of Nursing, Department of Health Republic of Indonesia, and become a registered nurse as Saint Vincent Private Hospital, and then registered nurse at Saint George Hospital, and then registered nurse at Geneva International Agency, and then registered nurse at Royal North Shore Hospital, registered nurse at Royal Prince Alfred Hospital, and then become a clinical nurse specialist at Royal Prince Alfred Hospital. Okay, and for international conference and good clinical practice experience is about apheresis from 2005 until now, hematology and renal, various setting, and school of nursing. Okay. Nurse Paul have been a speaker from many seminars, and for the newest one in this year, 2023, Nurse Paul as a guest speaker for International Seminar of Diaspora, and then speaker for apheresis emergency for ICU nurses, apheresis role in kidney transplant in Australia. Okay, that's all the curriculum vitae of our speaker. Yeah.
Thank you very much, Bu Puspita.
Nurse Powell, you have 35 minutes for your presentation. Do you want to share your screen by yourself, or the committee will help you?
I would like the committee to provide the slide, please.
Okay. Please, the committee help to share the slide.
First of all, I would like to thank Student Association of Nursing Department, Health Polytechnic Ministry of Health Jakarta 3 for the invitation of this international webinar. I would like to big shout to Anaisha Putri who reaching me to ask for this presentation, and my colleague when I was in Academy of Nursing a few years ago, Ibu Pramita, and I've seen there's a few of my teachers here attending these seminars. I'm so honored to be invited to present in front of you, in front of my teachers as well. And I think there's Ibu Made, Ibu Yupi, Bapak Aceh, and just recently Ibu Indriana. All of them is my teachers. Anyway, today my presentation is elderly health services through digital healthcare in Australia. I have to disclose that I'm not the expert of the geriatric nursing, but of course, it's in my field. Is as you aware, this is more and more. There's a we facing, or we look after the older population. I don't think it's the same like even in Australia or developed country. We have more than than in Indonesia. Just for example, that is I can I'm working in hematology, in basically in especially in multiple myeloma population. Is most of the patient is above 60, and even we still transplanting them with when they're 70s, and then all comorbidities. We quite familiar, and even the disease is just recent one that is involved in CAR T cell therapy, which is like the latest technology in combating cancer, especially in leukemia and lymphoma, as well as myeloma. Most of them is above 70s. Yeah. It's very interesting. Is next month I'm presenting of my data in Melbourne in a blood conference. It's about the lymphoma with the CAR T, and then how we collect the T cell to this population. Is 75% of the lymphoma patient that we collect, and then we give it this therapy is above 60, and then half of them above 70 years old. And even we still do the procedure of this therapy to 80 something years old. It's amazing. And then of course it's more and more we facing of this elderly population in our practice. And then I just give it a little bit. This is how to look at from digital healthcare point of view for this population. Next slide, please. What really defines an elderly a person is this, in Australia we define this elderly person or population is 60 plus, 65 plus years of old. And we can see, look at that Titik Puspa, everyone knows is this Nenek Cantik. She's still beautiful and healthy in it, even though she's already 80s. In Indonesia itself, is according to Department of Health of Republic in Indonesia, 60 and above is defined as elderly. Next slide, please. As we know, this is healthcare needs for all the population or all the people are very complex. Yeah, the care usually fragmented. It's hard for them to aim the health goal. And the healthcare needs for the elderly as well is complex, because they need a lot of things. And next. I'll give you one of the myeloma care already mentioned before. It's about the myeloma care. It's about myeloma. The patients is in the central, all right, and then this patient's gonna be visited by different kind of person. There is a myeloma clinical nurse specialist. There is this bone marrow transplant. They can be admitted to the hospital if the patients inpatient. And then they see the community specialists, apheresis unit for the stem cell collection and infusion, ambulatory care, social worker, pharmacists, community, And yeah, and this is of course it's a general practitioners or doctor umum, and a clinical trial if the patients go for the clinical trial. And then for all of this one, we need the coordination. It's the best way to do the coordination is by digital care or digital health. Next slide. Next slide, please. Yeah. And the needs of the this population, yeah, they want is the healthcare to be seamless. You know, this it's not this in this is called ruwet. You know, this is very hard or fragmented. They want to be seamless, and this is very easy. And they want to have a partnership with the healthcare team. It's not about that they need to tell they to be told to do. And some of them didn't communicate, especially in healthcare team. They didn't communicate to each other. They lost contact of each other. They don't know what is happening to this patient. And then of course this is they not uh, this is not communicate in this case. Just for example like this, all right, in this patient or this elderly at home, and this is usually seen by general practitioner, and then she mentioned and documented in the GP. She doesn't want to be treated. If you go to the hospital, she doesn't want to be treated as a to go to ICU if something happening, if the patient need to be admitted to ICU. She just doesn't want to go to be treated that way, or doesn't want to have like resuscitation, something like that. Just go for the palliation pathway. And anyway, this patient just fall down in the backyard, when it's doing the gardening, something like that. And then the ambulance coming in, and then still some reason, and then this is the patients got the cardiac arrest things while on the go to the hospital. And then the ambulances staff doesn't have any detail of this patient, and then this is they resuscitate this patient in on the way to the hospital. As soon as arrive the hospital, patients go to ICU and so on and so on. And then what the patients want is not achieved. It's not this is provided by healthcare, because it's some losing communication between one and another. And the other thing, this is most of them feel like this is they're just a number of the patient being treated. And if you look at the situation in Indonesia, you see sometimes it's my friend just mentioned that it's every morning 4 o'clock or 5 o'clock. She has to go to the hospital, taking the number to be, and then waiting for hours, so the doctors can or specialists can see this patient. And it's time consuming. It's not only for the patient, it's time consuming for the family. And then this is, I mean, this is Indonesia. We're lucky. We have a lot of people that can help. But if you put that situation in a developed country, for example, Australia, no one's gonna take once or twice. You can take them to the appointment or once or twice, but not every time. And then yeah, who's gonna providing this service? Next slide. And the way to combat to these things is by using the digital health. Yep, digital health has become a vital part of modern system. It's accessible healthcare system. Which is designed to meet the need of all Australian. This is in Australia, including all the people population. And in Australia, we have a digital health services, which is including My Health Record, electronic prescription, and telehealth. However, there's another one. This is we have here in Australia, including healthcare identifiers, electronic referrals. We already started electronic medication charts, access to trusted data, something like that. In the hospital itself, we have the call EMR, electronic medical record. It's based on the Cerner system. And in other part of Australia, sometimes they use it like a base on a cloud system, which is they call Epic. And it is more and more now that we use digital health to providing the service. Next slide. This digital health is a health system where healthcare knows and understand you. In this case, is the people, all the people. Is and then we can have more complete pictures of the patient's health or the elderly health. Can help your healthcare providers make more informed decisions about your well-being. And through a connected healthcare system, your healthcare professional can deliver treatments that safer and more personalized. I mean, this is a different people, it's different needs and different wants. And then by having this, the data that everyone can access, the health professional can access, is a more personalized care can be delivered. Next. Next, please. Next slide. Digital health can improve your well-being by connecting you to the latest tools and technology, giving you greater control and better access to your health information. For example, like this is your blood results is in digital health, yeah, in my health record, and then it is by looking like that, and your GP may be able to recognize you and then put in some tools and then put it all the data in and then come up with the conclusion that, oh yeah, you diabetic, for example, or you pre-diabetic, this is what you need to do, and so on and so on. Next slide, please. One of the digital health in Australia, they call My Health Record. This is My Health Record is all Australian in I think it's 15 and more. They have their own what they call MyGov. This is a website, and then it's very personalized, and then all the data is there. For example, my health records is there, and a tax there, Australian taxation office there, something like that is for your taxes. You don't have to ask, and automatically you can see how much tax you pay per year, something like that. And then the summary there, and then if you on the on benefits in community, or you having the government paying the money, and then and including link to Centrelink, this MyGov. And there's a lot of things. This is available in MyGov. One of them is as I mentioned before, is a healthcare record. My healthcare records is information from healthcare providers. For example, this is if you're seeing your GP, the GP is going to make it the summary of this is seeing it, and then put it into your health summary. And then if you've been to the hospital, whatever the treatment in the hospital, they give you the summaries, and then you can access the summaries of the discharge later there. And blood test and scans results is available as well, including medication, current medication and prescription and referral letters, something like that. Next slide. Next slide, please. In my health record, there is information from Medicare as well. For example, Medicare and pharmaceutical benefit SIM information. This one, just for example, the medication, and if you buy, if not in the PBS list, you can pay like hundreds of thousands of dollars of the medication. But is in the PBS, you only pay up to something a certain time, a certain money, maybe it's about $50 or less. One is very or even free. I usually is provide this medication that we have to give it to the patient for subcut injection. The price of the medication is about $6,000. You know, this less and less, and then after that, this is a cheaper. However, the patient doesn't have to pay for this medication and through the PBS benefits. The next one is Medicare and repatriation schedule for pharmaceutical benefits, or they call RPBS information. This one is for the veteran staff. You know, the veteran of the. Sorry, just give me a second. I just have to tell them to go away, my children. Just give me a second. I'm really sorry. This I have two twins. They just make us so noisy. Yeah, this one is a veteran affair. This is like ABRI in Indonesia, and they have some special benefits for the people. It's including the family, the wife, and the children, and then sometimes the service not available for the community of Australia. However, with this the RPBS able to help them and pay for all those things. Yeah, I think it's the big money. You know, this is allocated for veteran, or maybe the government is very respectful for the veterans affairs people. Anyway, the other one, this is in my healthcare, is immunization. This is all immunization available in this my healthcare record. Next slide, please. In my health record as well, information you add to your record. For example, you can put who's your emergency contact, or you have another current medication, or you have allergies. If you're not reported, or you can put it up there. Even the personal health notes. If you're indigenous status, like in Australia, this is Aborigine, and then people from the island in very close to the top of the Queensland island. This is they have some special SIM for them. And then you can put that one as well, a veteran or Australian Defence Force status, and your advanced care plan. Your advanced care, it means is what do you want it to be done if you go to the hospital? You can put in my health record. So when you come into the hospital able to see it. Advanced care is like you don't want it to be a CPR, that you don't want it to have a CPR or something like that, or you don't want it to go to ICU. Is there? All right. Can I see the slide, please? I cannot see the slide.
Wait for a second. There is a trouble.
Sorry. Yeah, thank you. It's come up now. Next slide, please. Okay, the next one in digital health is electronic prescriptions. It's a digital version of the paper prescription, resep, in Indonesia they call it, yeah. And then during the consultation, the doctors can provide the prescription. You don't have to get the paper chart, and then your doctors can send this the prescription to pharmacy. And or if you like, they can send you as a SMS, and you can send this prescription to the pharmacy or apothec that you like to be sent. And the other thing is a very now is this digital era. Yeah, this is like you do the shopping, and then as soon as you send to the pharmacy, the chemist, which is the apothec, they can send it to you. All right, and then send it to you at home. It's very convenient, and this is a cut a lot of time from you. And or if you like, you can just take it to the pharmacy, and then you get it home. And then sorry, and you have if you have repeats, and then just ask them, just pick up the phone, ask them, can you just send me the another medication, that's medication, please, this the repeat, something like that. However, with the electronic prescription, is only available is if using your doctor says, I think it's about 6 months, within 6 months, something like that. I'll talk about that once further when I talk about the telehealth. Next slide, please. Oh, here we are, the telehealth. A consultation with the healthcare providers by phone or video call. Other
Nah, ini sih yang Aira itu sekalian.
Other healthcare providers now offer telehealth consultation when physical examination isn't necessary. And it's not intended to replace essential a visit to the doctor, but rather be a convenient solution when you cannot see a doctor face to face. And then, of course, back bill with this consultation. Back bill, it means you don't have to pay anything, and the Medicare will pay for the consultation. And it's very interesting. We have a patient from Adelaide need to be treated to our hospital with this therapy. She's about 70 something years old. And anyways, our doctors able to do the telehealth with this patient, and then organizing everything. And then the patients flying from Adelaide to Sydney, and then get treated and get everything's in Sydney. And then after that's going back to Adelaide. It is very time consuming. If you have to do face to face, you have to wait up here, how much they have to pay for the hotel and everything. Yes, it's very convenient, and it's very money saving. Next slide. And with the telehealth, it's not only the doctors, the nurses. You can see the nurse, psychologist, surgeon, and without having to visit them. And if you're unwell or need to be self-isolated, you can still attend a consultation. You just pick up the phone, ask them, and the doctors will call you back whenever they're available, whenever they time. And if you live in rural area, Australia is a big place. It's most of the people who live in these far remote areas, they have to travel for hours to get to see the doctors or to see healthcare providers. By doing this consultation, saving them time, and then they can do the consult through the phone call or for video call. Next slide. Next slide, please. And then with this telehealth, allow all Medicare eligible Australian to access the telehealth service for range out of hospital consultation. And then we, of course, is the provider still can get the money as usual. It's like you seeing the patient, but it's more convenience for the patient. This is not only, as I mentioned before, the nurse practitioners usually they're very independent. They prescribe, they see the patient, even they order the patient to have the X-ray, for example, or MRI, something like that. And then they can do that one through the telehealth, and then so the patient when they're coming in just go to that place, which is already organized through the video call or telephone. Next slide. Now, this is I'm working in Royal Prince Alfred Hospital. This is the first hospital who providing this what they call virtual hospital. And then this is started before the COVID time, but this has become is huge. It become a big when in COVID time, because it's we able to provide these all services to us Sydney siders or people living in Sydney. And then this is the visitors or something like that's coming to Australia. Yes, it's amazing. And then it's just one of the big game changing in healthcare, digital, since the COVID coming. I know it is very sad and everything, but we learn a lot from the COVID time. And it's a personalized service for people in our community. This is a new way of caring. Staff at the RPA virtual care center are available to connect with the patient and their carer 24 hours a day, 7 days a week. Next slide. In the COVID time, if they said COVID like this, the symptoms, and then they can stay at home, and the community nurse can coming in, giving them the saturation oxygen, giving the devices or something like that, and then the people in the hospital are just monitoring them all with the monitors, and then these people in RPA virtual care can able to escalate whatever this is happening to the patient. They can send them the ambulance to pick them up to go to the hospital. The patients doesn't have to go through the emergency, just go directly to the ward dedicated for the COVID patient. This is it in COVID time. But now what they're doing is they invited, for example, if patients in the hospital, they look at like this, and then they choose which one the best patient to be invited for this model of care and be part of the RPA virtual hospital. This one is not stop. The other service is still available. This one is additional service to provide support and care for the patient and families. And it is another way that we can ensure that we are providing the right care and in the right place and the right time for the patient and family members. Next slide. Currently in RPA virtual care in our hospital there is a virtual fracture clinic, medication monitoring, tuberculosis daily observed therapy. I know it sounds crazy, but Australia is very scared of tuberculosis. If you're positive tuberculosis, God, the old days, this is it's very interesting. I have my relatives coming to Australia, a student. I was already working there, and then since they look it up, there is a positive with tuberculosis. God, has to be stay in the hospital, and we have to be screened everything. Even the little kid has to be a screen. Lucky I'm already my mantle positive, and the result that I have a chest X-ray and everything, I'm all right. I don't have to be on medication. This little kid has to be on medication for 3 months, and this person who's sick with the TB, isolated in the hospital with the negative pressure room, and then all the medication finished, and after that, as an outpatient, they have to come in to take the medication. Rifampicin, you have to take it in front of the nurse that make sure you're taking it. If you fail to turn up, the police gonna come in and search for you so you can take medication. And then with this medication monitoring, they can doing it by looking at is they taking it, something like that, instead of the patient coming to the hospital. And the other one, this is the virtual care is available from RPA is medication monitoring. If the patient taking medication themselves, in this case immunoglobulin, a lot of them this is quite this old and able to giving themselves or the the carer can giving it to them. Yeah, we can monitoring them. And the other one is very useful is residential aged care facilities triage line. In this case, is after hours. For example, if we the residents, people who live who stay in aged care or nursing home, they call is a resident. If residents is need to go to the hospital, for example, they don't have to go or something like happening or febrile or have a fever or something like that or whatever reason, and they don't have to go to emergency, and they can communicate with RPA virtual care, and then they can have a chat with them, and then when the patients need to or the residents need to go to be admitted to the hospital, they can go directly to the ward, which is this is already providing it through the RPA virtual care. Next slide. This one is RPA virtual care is a health maintenance program for lower leg ulcer as well, clinical care for the COVID, as I mentioned before, clinical care for COVID negative patient. In special health accommodation, we have the special health accommodation, which is the hotel converted or apartment converted to be like in Indonesia, like a hotel. It's Senayan, isn't it? It's sports hotel in Senayan, something like that. And COVID-19 quarantine discharge support service, it is providing this one as well too. Even this is for the palliative care patients. Next slide. RPA virtual care is under Sydney Local Health District, which is I mean, RPA Hospital is under Sydney Local Health District. There's a few hospitals under that one, and we work together with the community. It's just a community nurses and we're providing 24 hours, 7 days a week, a personalized service through this virtual care. Next slide. Yeah, it's allow patient to improve. It's allow hospital to improve patients' experience by delivering care in the home rather than in the hospital. In the beginning, it started with palliative care patient, adult cystic fibrosis, and patient at risk of recurring lower leg wounds. And then, yeah, this is the patient has to accept that if they invited to enroll for the RPA virtual, they can say no though for this one. Next slide. They or the carer can contact the nurse using a lone smart device, which will also offer the capability of recording and updating health information. Care will be delivered by telephone, video calling, and also by remote monitoring of patients' data and health information. This technology gives the healthcare providers to connect to the patient and the loved ones to the very best of care when and where they need it most. The registered nurse will be able to arrange for home visit or refer patient to the hospital care team if needed. I think my time is a bit will be finished soon. Yeah, I will be quick. It's a new way of caring, which can be adopted by Indonesian. It's innovative and exciting opportunity to provide enhanced medical services to our community. It means is we have to work together. This useless if you don't have like a good support in the hospital for this patient, and then it's just whenever they need the help, this is you should be able to escalating it and then providing this kind of service, so the residents or the patient can be treated as soon as possible. And then, yeah, ESEC extend the services provided through the Sydney District Nursing Team, which is the community nurse, we currently deliver in-home nursing care to more than 1,000 patients in community at any one time. Next slide. Apia Virtual Care Center team will support the early discharge of patients from hospital and integrated care in the comfort of their own homes, backed by regular monitoring during virtual ward rounds. Next slide. By the way, this virtual care by RPA is the model. They cut the number of unnecessary ED presentation, reduce the patient's length of stay in the hospital because they can go home straight away and they're still being monitored, and to empower patients, especially those with chronic illness, to lead a better quality life at home or in residence or wherever they stay. It's a comfort from the families, comfort knowing that they are connected to the best of care at any time of the day. Next slide. Yeah, some people say the RPF V12 is more than an excellent care. It's a peace of mind for those who need it most, which is our patients, their families, and loved ones. I think since I already mentioned that one before. Next slide. Oh, I think this is a doubling. In summary, and by all those that I presented earlier, this is I mentioned earlier, healthcare should be seamless. This is and patient will have a partnership with a healthcare team by providing this service, and healthcare team will be able to communicate each other by knowing this is what's happening to the patient before you see the patient. We already know the details or the summary of the patient. And this is the best way to personalize care that value to the patient. And as we agree, the patients are not just a number. Any questions? Thank you.
Paul, it's interesting to know the digital health service in Australia, but we have a limited time, and now we will go to discussion session.
Thank you.
Okay, is there any question for Nurse Paul? You can raise your hand or write your answer in chat room. Okay, I see a question.
Thank you. I can read it. Yeah. One of RPF virtual current in Australia is monitor for TB patient. Is TB incidence high in Australia? No. That's why they scare of this. If the patient's coming with TB, it's just like big hoo-ha. This is we try to protect the community. This is spreading the TB. Yes, this is it's not high at all. One day, we have our patient. This is my colleague. I was working in St. Vincent's private hospital before, and one of my colleagues went for holiday and contracted with TB, and then it's just been coughing in the ward, and they coming with positive TB. It's like the whole world in that time. It is like maybe now it's not as bad as it used to be because with the COVID, yeah, because we quite aware. And that time just like big, everyone need to have the Mantoux test. Of course, I'm positive, and then this have to do X-ray, and then they have to monitoring me for 3 months. Everyone in that ward, can you imagine? Everyone, yeah, yeah. This is very very low incidence. Yeah.
think Ika can get it, the answer. Now I will read the question from the chat room. Good morning, my name is Anna Arista. I want to ask, how does the Australian government regulatory framework support or hinder the adoption of digital healthcare service for the elderly? And what change might be necessary to enhance this support?
Yeah, this the thank you. This is very very good question. The digital health. This is they offer you, you can say, I want to get this as my health report, and you can adopting it. Otherwise, you can say, no, I don't want to. Yeah, this is for every people in Australia. They give it the option to adopting it or not to adopting it. Yeah, with the healthcare. And then for teleconference or telehealth, this is what you call it, this is it's up to you too. This is if you want to be contacted or not. Some people said I don't contact it, but for the health record, yes. For example, you seeing the doctors up here, and then you in the health record, yeah, you say you have already health record, and then our conversation with the doctors and said, no, I don't want the summaries put in the healthcare record. You have to tick something up there. Everything. There's even the blood test or is there. That is you can tick not to be reported in the health record, something like that. You able to, and of course, like if you go to the hospital, you binding with the policy in the hospital that you cannot share whatever that is in electronic medical record. Yeah, like you when you're working in the ward, for example, you're writing the report of this patient, and then since you binding with that whatever the policy in the hospital about the electronic medical record, something like that, and you have to follow them, and you have to what you call it, yeah, you have to otherwise you're gonna be in problem, isn't it? The same thing like a discharge summary. You can just if the patients want to be in discharge summary or not, this is they give the opportunity to there's option for them to say no or yes, something like that. If you not tick no, it means it's gonna be yes straight away. I hope this is helping, Hannah.
Okay, I think you've seen the explanation from Paul.
Yeah.
For the question come from Salsa Okta. Can digital health service ensure equitable access for the elderly? What about the family of elderly who cannot access these digital health services?
Okay. This is everyone have the access. Yeah. And if the elderly, if you pointing out your carer, and then you can make it the option that other person can accessing it, but you have to be like put it is in writing, something like that, or whatever. This the rules that you have to follow. It's not everyone can just accessing it, like a guidance guardianship. This is you go for that one, and then this is become the guardian, is able to access digital files or digital information about you, something like that. Yeah, of course this elderly sometimes it's hard to know this one, but by having the carer or the guardian for those people, they can help. Anyway, thank you.
Okay, I think this is challenging, maybe in Indonesian condition. So I think the digital health is have to make easy to use for everybody, like for
Yeah.
elderly too.
Yeah,
Yes.
I think it's if a health record probably is still hard, but at least telehealth already starting, isn't it?
Yes.
Yeah. A prescription, online prescription or electronic prescriptions is, I know it's still a lot of hurdle that we need to make it work, but at least telehealth and video call is available that we can use. We can use WhatsApp, something like that. Even this is a for discussing about the patient, we can use the WhatsApp. I mean, you can use the WhatsApp group, so they if the family member something like, they can listen to it, something like that, isn't it? A kind of like that. Anyway. Thank you.
Okay, thank you, Nurse Paul, for your.
I think he's still on mute, Bu Puspita.
Okay, thank you, Nurse Paul, for your sharing your knowledge and information about the digital health service in Australia. It's interesting to know about that, but no, the time is up.
Thank you.
Okay, so we will finish our session today. But before you go, maybe you can give the closing statement
Okay,
of
yeah.
discussion.
Thank you for the opportunity. First of all, as a nurse, I think we are nurse here, most of us, yeah. We should provide personalized care for our patient because everyone is different. Their needs is different, their preference different. Yeah, everything's different. And the second one, that's I want to garis bawahi to you know in Indonesian to say it is this when you can make it easier something when you work, why you make it harder, something like that. That's all. Thank you.
Well, your certificate. Mrs. Putu, are you ready for give the certificate?
Yes, Mr. Susita, Mrs. Susita.
Okay. The committee, please share the certificate in this Zoom.
Okay. Thank you, Mr. Paul Malau, RRM, BNNMM, as a speaker for sharing material at the International Seminar of Health Polytechnic Nursing Student in Jakarta 3. And please accept the following virtual certificate as a speaker. Thank you, Mr. Paul.
Thank you.
Okay, thank you, Mr. Paul. It's a pleasure to see you through Zoom. Maybe we can meet in another event. Okay,
Thank
so
you.
I think I will end this discussion today as the moderator of the International Webinar Season 1. I apologize if there were any mistake while I lead this discussion. So I will return the seminar activity to the Master of Ceremony. Thank you and give applause for our speakers today.
Thanks to Mrs. Puspita Hanggit MCUP, nurse specialist keperawatan komunitas, who has guided first session, also to Dr. Pukovisa and also Mr. Paul, who has shared wonderful knowledge and experience to us.
The next is symbolic awarding of certificate to the moderator, which will be delivered by Head of Applied Bachelor Study Program, Department of Nursing Health of Jakarta 3, Mrs. Niluh Putu Ekarini, MCUP, Nurse SPCUP MB.
Okay, for the committee, you can screenshot this.
Mrs. Putu still mute.
Okay. Thank you, Mrs. Puspita Hanggit, as a moderator for the first session in the International Seminar, and please accept the virtual certificate as the moderator. Thank you.
Thank you, Mrs. Putu. Thank you for the opportunity that gives to me from the committee.
Okay, before we continue to the next session, I would like to remind to all the participants to activate the camera. Okay, ladies and gentlemen, before we continue the next session, I would like to inform that our event is sponsored by Alzheimer Indonesia Regional Coordination Bekasi. Next, we enter the event of second session. We'll present second speaker from Indonesia and also Germany. Question and answer session will be guided by our second moderator, Jessica Astuti. So, as you can see now, this is our second moderator. Her name is Jessica Astuti Pereira. She is a nursing student in Health Polytechnic of Ministry of Jakarta 3. She is first runner-up winner of PMR Wira Group competition in Depok 2019.
Wow, she's so smart. Yeah.
Yeah, she's so smart. Let me greeting our second moderator. Hello, Jessica. How are you today?
Hello, Royhana, Satrio. I'm fine.
Okay, Jess. Are you ready?
Yes, I'm ready.
Okay. So, you can start guiding this session right now.
All right. Thank you, Royhana and Satrio. Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. Best wishes to all of us. I'm Jessica Astuti Pereira. I will guide this session with the themes, the Android-based Kedusio RSM. Application is an educational and cognitive stimulation for elderly and their families by Dr. Raden Siti Mariam, SKP, MKEP, Nurse, SPK, Com. An efficacy of brain gym on the cognitive function improvement of elderly people with dementia by Nurse Henny Silalahi, SKEP, MA. So before we move to the main event, I would like you to know more about our third speaker that we all know. She is our fabulous lecturer. All right, this is the CV of Mrs. Mariam. Her full name is Dr. Raden Siti Mariam, SKP MGEP, Nurse SPK.com. And I will read the newest one. For her educational background, in 2017 until 2022, she was graduate from Doctoral Nursing Program, Faculty of Nursing at University of Indonesia. And for her employment history, in 2002 until now, she was a lecturer at Health Polytechnic Ministry of Jakarta 3. All right, and for her membership, in 2022, she was a facilitator of Japan project at National College of Nursing Japan for virtual reality demo. And then for her achievement, in 2023 until 2025, she is participant in the postdoctoral training program scholarship from the School of Nursing, University of Michigan. There's a certificate that she got. She was a founder of computer program application Kedusio RSM for Android base. And there's a journal published in the October 2023. This is a Kedusio RSM, an Android-based nursing model for dementia prevention and better cognitive function in older adults. All right, now we will move along to the presentation session. And for the audience, we remind you to use the opportunity to knowledge from our speaker as well as possible. After the presentation of the material, there will be a discussion section. So for all the audience can directly send questions via Zoom chat or chat room with the format name_institution_questions. And the audience can also directly ask our speaker by using the raise hand feature on Zoom in the last session, all right? So without anything further ado, let's speak to our fabulous speaker. Hello, Mrs. Mariam, how are you?
Hello, Jessica. I'm fine. Great, thank you.
Are you ready, Mrs. Mariam?
Okay, thank you. I will share my presentation with you.
All right, Mrs. Mariam, your session will be presenting for 35 minutes and 15 minutes for discussion section, but in the last session. So, Mrs. Mariam, stage is yours.
Okay, thank you for the moderator, Jessica. Assalamualaikum, good morning for all the participants in the Zoom and the YouTube. Before I present my slide, I will to ask you for all this question, okay? Which one of you suffers from hypertension and obesity? Number one, and number two, have you ever had a cognitive screening test? Okay. Number three, did you know that lack of cognitive stimulation has a risk of dementia? This is a slide to guide of you about my presentation next. Okay. Slide number 2, I want to show about the policy support for other adults from WHO. We know that each year we commemorate International Day of Older Persons on 1 October, right? To public awareness about the opportunities and challenges presented to the aging population and to mobilize the families, community groups, and stakeholders to difficulties faced by older people. In 2021, the theme of International Day of Older Persons is about digital equity for all ages. And in 2022, about the resilience and contributions of older women. And now in the 2023, the theme is about fulfilling the promises of the Universal Declaration of Human Rights for older persons across generations. And we have a Perpres number 88 in 2021 about Stranas, Strategi Nasional Kelanjutusiaan, how to obtain independent, prosperous, and dignified in older adults. I think this is the policy support for older adults, and we must know about it. Related to my presentation is about the Android-based Gedusia RSM application is an educational and cognitive stimulation tool for other adults and their families. This is based on my dissertation result research and has been published in 2023 in the Invermelia Global Journal. This is my outline. Introduction, what is Gedusia RSM? The content of Gedusia RSM application, research result, and the take-home message. We know that almost 141 older adults in Jakarta suffered from cognitive impairment of 91.8% according to the clock drawing test. And symptoms such as memory loss, 42.4% should receive more attention from families alongside other symptoms because it is progressive and can interfere with daily activities. This is my research result from in 2019 and 2023. In this chart, we will see about that dementia risk based on age of elderly. We can see the risk of dementia will continue to increase with age. In 60 and until 64, there is 46.8% and high in increase in the age of 65 until 79 years old is about 61.4%, and more than equal to 80 years old is increased is 73.1%. So risk dementia, we must know that will continue to increase with age. And elderly people with dementia will experience gradual cognitive impairment and other functional decline, which can interfere with daily life. So they will be highly dependent on their family members. And we call the burnout for the family member. There is the burden of caring for patients with dementia. With a person with dementia often comes with a high risk of stress for the family. Sometimes we hear the caregiver said, "Oh, I think I need me time for a while," just like that. Based on data, in Indonesia, the gadgets that are widely used today are smartphones, right? As much as 43% of the population. Smartphone as a communication tool, electronic media that can be used to obtain and disseminate health information is one of the educational facilities packaged in the form of health applications. I think we all of in the Zoom and YouTube have smartphones or iPhone maybe. This is in the current state of the COVID-19 pandemic in 2020, many people can access mobile learning through mobile applications, which facilitate the access and delivery of information. And the result of survey completed by 30 families in East Jakarta revealed that most of the families use smartphones and have funds to buy data packets. It's almost 100%, right? 96.7%. And the reason families to opening the have application and opening is were for curiosity, simpler than books, and more interesting and easy to read, and have problem that need to be understood. We can see and read about the health problem in this application, and more pleasure. This is the evidence about why what should we do? Yeah, the evidence. What should we do? Number one, I think we should be a concern, right, for all us to take steps together about the evidence early. Number two is early detection and diagnosis of dementia. Yeah, are crucial as the elderly population continues to grow. And number three, we must to prevent and manage the risk factor for dementia in the community. Therefore, this application was created. The name is Kedusia RSM application. This application is part of the Android-based Raden Siti Mariam family nursing model caring for dementia. This is family nursing intervention based on Android application that focus on the problem of dementia risks for elderly with a family healthcare task approach where the family will carry out care management, maintenance, and monitoring independently via Android. So the family can do care management, how to maintenance and monitoring independently. Kedusia RSM stand for Keluarga Peduli Demensia Raden Siti Mariam. It stand for Keluarga Peduli Demensia Raden Siti Mariam. Kedusia RSM nursing model emphasizes family nursing care and community empowerment to prevent and manage the risk factors for dementia in the elderly through an Android-based application. This is based on Android. Then the three roles in the apps, there is a user as a nurse, user as family or caregiver, and older adult. This is the appearance of the application. This application is equipped with a change password menu, information about the application in the usage guide, and nurse as user can log in and view profile data and menus related to model explanation. And the content of the family and elderly menus in this application, we can see include health education materials with 3 interactive video about how to know dementia, how to know a risk factor for dementia, prevention efforts, and dementia prevention skills carried out by the family, and interactive articles about the stage and symptoms of dementia, how to communicate with elderly experiencing cognitive decline, and cognitive stimulation in the elderly, and a menu a guessing game to guessing a picture, colors, and the letters. The games in the application are only one part of the cognitive stimulation activities that the elderly can do with their family. This is the appearance for the app, family and elderly menu. And in the application is there is a workbook, buku kerja. The workbook menu in the application must be filled in by the family regarding their skills in caring for the elderly at risk of dementia. There is 18 skills. It is possible to attach a photo and activity with the elderly. We can upload a photo and activity with the elderly, family and elderly, and medical card, and of skill that must be learned and filled by the family to this workbook. This is the logbook in the app. There is 18 items for the skill. This logbook for the self-monitoring for the family, how to care the elderly with the 18 items for the skill. In the previous slide, I asked you about the risk factor for dementia, right? This is 12 dementia risk factors from the Lancet Commission in 2020. There is physical inactivity, smoking, excessive alcohol consumption, air pollution, head injury, infrequent social contact, less education, obesity, hypertension, diabetes, depression, and hearing impairment. This is the answer for the risk factor of dementia in interactive video in the app. You can see this video before.
Okay, for all the participant, there's a problem on the sound, so sorry if you should to wait it.
Saya jadi takut kalau anggota keluarga ada yang mengalami demensia. Risiko demensia. Pada video ini, keluarga akan diajak untuk mengenal faktor risiko demensia dan faktor protektifnya, serta bagaimana upaya mengurangi resikonya. Saya jadi takut kalau anggota keluarga ada yang mengalami demensia. Apa saja ya faktor risiko dan faktor protektif diketahui? Faktor risiko adalah faktor yang memberikan dampak negatif pada seseorang, sedangkan faktor protektif adalah faktor yang dapat meminimalkan dampak negatif atau bersifat melindungi. Ada faktor risiko yang tidak dapat diubah antara lain 1. Usia, yaitu terjadi peningkatan 2 kali lipat setiap 5 tahun pada individu di atas 65 tahun. 2. Jenis kelamin, yaitu perempuan lebih rentan menderita dibanding laki-laki. 3. Keturunan, yaitu kewaspadaan apabila ada yang menderita demensia pada orang tua atau saudara yang sedara. Faktor risiko yang dapat diubah antara lain 1. Hipertensi atau tekanan darah tinggi. 2. Hiperkolesterolemia atau kadar kolesterol yang tinggi. 3. Diabetes atau penyakit gula. 4. Depresi atau perasaan sedih dan tertekan dapat membuat seseorang menarik diri atau isolasi sosial. 5. Merokok. Hal ini dapat mempercepat penyempitan pembuluh darah akibat racunnya. 6. Obesitas atau kegemukan. 7. Kurang tidur. Waktu ideal untuk tidur adalah 7-8 jam per hari. 8. Cedera kepala. Menjaga agar tidak terjadi kecelakaan atau benturan pada area kepala. 9. Gangguan pendengaran. Hindari mendengarkan musik atau suara yang terlalu keras. Faktor protektifnya yaitu 1. Aktivitas fisik dan sosial. Olahraga teratur bersosialisasi akan menjaga kesehatan fisik dan fungsi otaknya. 2. Aktivitas mental, stimulasi otak. Hal ini dapat dirangsang dengan bermain puzzle, mengisi TTS, mewarnai, berkebun, main tebak-tebakan, bernyanyi, dan lain-lain. 3. Diet seimbang. Perbanyak makan tinggi serat, kurangi garam, dan lemak. Apa saja sih pencegahan dan pengendalian yang harus dilakukan? Saya tidak mau anggota keluarga mengalaminya. Yaitu cerdik, menjadi langkah dalam mengurangi risiko demensia. Yuk kita lihat satu persatu. C. Cek kesehatan rutin, termasuk tes fungsi otak. E. Enyahkan asap rokok. R. Rajin aktivitas fisik, spiritual, dan stimulasi otak. D. Diet seimbang. I. Istirahat yang cukup. K. Kelola stres dan bersosialisasi. Ingat, obat-obatan yang efektif menyembuhkan demensia belum ada. Kita berusaha memperlambat gejala yang ada agar tidak semakin berat.
Okay, this is about interactive video, risk factor for dementia. You can see in the apps. And what's the problem, Jessica? For the second video, it's about the skills to care of elderly. 18 skills to care of the elderly. We can see in this interactive video.
Mengapa dukungan keluarga sangat dibutuhkan lansia dengan masalah risiko demensia? Kita ketahui bahwa keluarga merupakan lingkungan terdekat dan sistem pendukung yang sangat berpengaruh terhadap pertumbuhan dan perkembangan lansia. Hal ini diperkuat dengan adanya saling keterikatan dan ketergantungan satu sama lain. Apa sih dukungan keluarga itu? Dukungan keluarga adalah bantuan yang diberikan oleh anggota keluarga lain yang akan memberikan kenyamanan fisik dan psikologis pada orang yang dihadapkan pada situasi stres. Dalam hal ini adalah orang lanjut usia yang berada di keluarga dengan masalah demensia. Dukungan keluarga sangat dibutuhkan lansia untuk meningkatkan kualitas hidupnya. Apabila dilakukan secara harmonis, dengan dukungan petugas puskesmas dan partisipasi masyarakat, diharapkan dapat meningkatkan kemampuan lansia dan keluarga dalam mengatasi masalahnya, serta menjaga kesinambungan dalam pemeliharaan kesehatan. Mari kita lihat satu persatu apa saja perilaku dan keterampilan yang harus dilakukan dan ditunjukkan oleh keluarga kepada lansia. Tentunya ini sangat bergantung pada kondisi lansianya masing-masing. 1. Saat berbicara dengan lansia, keluarga duduk berhadapan dan menggunakan kalimat yang pendek. 2. Keluarga melibatkan lansia dalam kegiatan sehari-hari di rumah sesuai dengan kemampuannya. 3. Keluarga membawa lansia melakukan pemeriksaan gula darah dan kolesterol ke posyandu atau puskesmas atau rumah sakit. 4. Keluarga menyediakan makanan yang sesuai dengan kondisi lansia. 5. Keluarga membawa lansia untuk memeriksakan tekan darahnya ke posyandu atau puskesmas atau rumah sakit. 6. Keluarga membantu lansia melakukan aktivitas seperti mandi, buang air, makan, berpindah jika lansia tidak mampu melakukannya sendiri karena sakit. 7. Keluarga membantu lansia dalam hal keuangan atau dana pensiunnya untuk berobat. 8. Keluarga membawa lansia untuk periksa kesehatan karena sudah lanjut usia, sering lupa, dan suka marah-marah. 9. Keluarga mengajak atau menemani atau membebaskan lansia berolahraga secara teratur untuk mengurangi resiko terkena demensia. 10. Keluarga mengingatkan dan melihat lansia untuk minum obat anti hipertensi secara teratur dan sesuai resep dokter. 11. Keluarga memberikan dukungan dan semangat bagi lansia dalam melakukan aktivitasnya sehari-hari seperti mandi, berpakaian, dan makan sendiri. 12. Keluarga menghargai keputusan lansia dalam beberapa hal terkait pengobatan dan penyakitnya. 13. Keluarga menjelaskan kepada lansia mengenai hal-hal yang dilarang oleh petugas kesehatan terkait penyakitnya. 14. Keluarga mengingatkan lansia agar mempertahankan ingatannya dengan kegiatan stimulasi kognitif seperti bermain tebak warna, huruf, gambar, isi teka-teki silang, berkebun, bernyanyi, mewarnai, dan lain-lain. 15. Keluarga mengajak anggota keluarga yang ada untuk memahami kondisi lansia dan memberikan perawatan bersama-sama. 16. Keluarga mengingatkan lansia pentingnya minum obat secara teratur. 17. Keluarga meminta lansia untuk mengulang apa yang diajarkan. 18. Keluarga mengingatkan lansia untuk beribadah dan melakukannya sesuai kemampuan. Ingat, dengan dukungan keluarga dan partisipasi aktif masyarakat, lansia dapat tetap aktif, sehat, mandiri, dan produktif.
Okay, this is interactive video about the skills to care of elderly with the risk of dementia. And how we got there? You can install Kedusia RSM in Play Store right now. Yes, it is free from the Play Store. And I want to share about the door prize. Please install the Kedusia RSM application now and show it to the committee, right? There is a door prize for you if you have installed the application. Okay, next, the research result about the Kedusia RSM is the intervention of the Kedusia RSM model with apps shows that performing nursing interventions on the elderly susceptible to dementia, the risk of dementia, including health education activities, exercises to maintain a healthy lifestyle, cognitive stimulation, mentoring and home visit, as well as providing motivation to families and the elderly can improve their cognitive function. And the activities of daily life, such as doing a regular exercise 3 times a week for a duration of 10 until 15 minutes, social activities in the community, such as gatherings and Holy Quran recitations, and mental activities or cognitive stimulation, such as crossword puzzle, playing chess, counting, and singing. Another research was there is said about brain exercise for the elderly is one way to prevent and manage dementia. It is preferable to carry out such exercises, which include physical, mental, and social stimulation activities in groups rather than alone. And the use of brain exercise more effective than relying solely on medicine. So if the elderly have exercise in the community, there is have advantage for the physical, mental, and social interaction, and there is to prevent cognitive impairment. The other researchers said that family members influence health promotion in each other. Primary prevention within the family in the main way to create healthy lifestyle changes, and ongoing care and assistance is needed by families and the elderly with health problems that affect their daily life. So there is the family as a support system for elderly is important. Okay, the slide for the take-home message in my presentation is about that Kedusia RSM application provides families with easy access to health services and health information online. And families can apply the skills they have learned independently, all in one application. And health information related to managing risk factors for dementia can be accessed by users, and the elderly can play games for cognitive stimulation. Video-based health education program used to facilitate the activities of health workers in increasing knowledge and understanding of health problems in the elderly. And this next message is controlling of dementia risk factors must be considered for families who care for the elderly. This is the references. This is my publication about the risk of dementia. You can see in the Google Scholar by my name, Raden Siti Mariam. Thank you for your attention, and I will return to moderator Jessica.
All right, thank you, Mrs. Mariam, for the material. So I will conclude the material from you. So based on the data, the risk of dementia is very high in the elderly. Dementia can be caused by stress, such as stress due to health problems, life, and the others. And for the Kedusia RSM application is a developed application that focuses on family healthcare tasks for problem of dementia in elderly. And there are a lot of benefit in this application, starting from the application that can be reached easily, then the application display is easy to understand, and the contents about dementia education that is equipped with interactive videos and articles too. And all the benefit that are not only the families, but also for health workers in increasing knowledge and understanding of the problems of the elderly people. Okay, this is the end of the session that was conducted by Mrs. Mariam. Thank you so much, Mrs. Mariam. The material was so interesting and informative. All right, colleges, our session has not ended here because we still have to listen the material that will be presented by our fourth speaker. Before presenting the material, I would like you to know more about our fourth speaker. All right. Hello, Mrs. Hani Silalahi. How are you?
Hello. Fine, thank you.
All right. Good morning, Mrs.
Thank you. Good morning also. Maybe guten Morgen from German.
All right. Guten Morgen. All right, Mrs. Hani, are you ready?
Yes, I'm ready.
Okay,
Thank
before that, I will introduce your CV. So this is CV from Mrs. Hani. Her full name is Nurse Hani Silalahi, SKEP MA, and I will read the newest one for her work experience. In 2020 until present, until now, she was a trainer project triple win, G2G, sustainable recruitment of nurses from Indonesia for employment in Germany. And 2021 until present, Central Quality Management at Stella Vitalis GmbH, Province Schleswig-Holstein in Germany. And then for her educational background, in 2015 until 2016, she was graduate from Bachelor of Science in Nursing, nurse program at University Muhammadiyah in Jakarta. And 2010 until 2012, she was graduate from Master of Science in Nursing at Evangelist Hochschule Darmstadt in Germany. All right. There's a hobbies of Mrs. Hani too. There's a traveling, yoga, and reading. So the presentation session by our fourth speaker, Mrs. Hani, with the themes efficiency of brain gym on the cognitive function improvement of elderly people with dementia. Now we will move to along the presentation session. And for the audience, I like to remind you again to use this opportunity to gain knowledge from our speaker as well as possible. After the presentation of the material, there will be a discussion section. So for all the audience, can directly send questions via Zoom chat or YouTube chat room with the format name _questions _institution, and the audience can also directly ask our speaker by using the raise hand feature on Zoom. All right, without anything further ado, let's speak to our fabulous speaker, Mrs. Hani. You will be presenting for our 35 minutes and 15 minutes for discussion section in the last session, of course. So, Mrs. Hani, the stage is yours.
Thank you very much, Jessica. Can you share the presentation for me, please, or the committee?
All right, for the committee, please to share the material of Mrs. Hani, please.
All right, thank you very much. Good morning or guten Morgen from Germany. First, thank you very much for the invitation from Polytechnic of Health Jakarta 3, especially for Ibu Mariam, because we have connected before and she asked me to be one of the speaker for today. And as I know, this institution has also the cooperation with a triple win or a G2G. Maybe I can try to connect it one or another subject in this program also. Today, I will share with you about the subject efficacy of brain gym on the cognitive function improvement of elderly with dementia. This topic is very interesting for me because as you see in my CV, I work in Department Quality of Management, and actually it's the company for residents of elderly. And this resident, it's also for people with dementia or elderly with dementia. Maybe we can call it in Indonesia panti lansia atau rumah lansianya gitu. Cuman dalam bentuk perusahaan saja gitu. And I work in this subject already around 10 years, and even I'm not working on the basic as nursing or the practicing nursing, but I have so many experience with people with dementia or elderly with dementia, and also I'm also contributing to improve the SOP or standard for caring of people or elderly with dementia. Okay, next slide, please. Thank you. It's already mentioned that the number of people or elderly with dementia worldwide increased in the last years. It's happened also in Germany. As you see here, there are 1.8 million people right now with diagnostic dementia, and we see how it will be improved from next year until to the next year. So you can see 2030, 2030 until 2050, we have a problem, or we have a main problem with people with dementia. That's why the government in Germany also really concerned to make a policy about caring of people or elderly with dementia. And as you know, dementia is also the problem not only for old people. Of course, it's mostly for old people, but it's also could be affect to young people. And of course, around 50 million people from 65 years old, mostly diagnosed with dementia, but as you see, there are people in young older between 30 until 65 years old also, and around 2/3 patients with dementia are women. I think it's also very necessary for us, because the mass population in the world are women, so we have to more concern about this subject, how we can prevent, or how we can protect this group or this population from dementia. Next slide, please. The healthcare cost for dementia in Germany is also from year to year increasing. Even in Germany, there is a healthcare insurance. Anyway, for all people who stay in Germany, they have to have health insurance, and it's really obligatory from the government in Germany. So we can give the best healthcare system for the people in Germany, but for the subject dementia in Germany, the cost is increasing from year to year, and we can divide the cost in two parts. The first one is the cost from the health insurance, and the second one is the cost from the own cost. It means the people have to pay the cost by themselves, or the family have to pay this cost by themselves. And as I told you before, that's the reason why the government in Germany very concerned what's the best solution to give the best healthcare system for people with dementia in Germany, because actually the government could not cover this cost for all the time, and I think in the next year or in the 10 years, it will be collapse with the cost, because the cost we pay to the government in the health insurance is not enough to cover the cost for people or for elderly with dementia. Next slide, please. Okay, how is the care system on patients with dementia in Germany? Actually, most of the people with dementia stay at home, because it's the best solution for the people self or for the patient selves. and of course the family can support these people for daily activity or support system general, and it depends on the situation of patient. Maybe the family can take the care, can give the care system by themselves, or sometimes they need also support from another people, for example from a private nursing. And in Germany we have many kinds of private nursing. For example, the nurse stay for the whole times by the patient at home, but there is also system. For example, the nurse comes only for sometimes or maybe for in the morning and give the help or the support for the people with dementia. And I think this one is the best method right now in Germany, because if we see the cost causes with this system is very low compared to another system. And I think also based on the experience, we have to support the people with dementia at home very much and very early, because if the support system not exist yet, I'm afraid that the dementia will be bad. And another system or care system with a patient with dementia is daily care. Actually, you can imagine it like daily care for the children in Indonesia, or for babies, something like this. It means the patient will be bring to the place or daily care in the morning, and then they got the activities or support from professional cares over there, and they support also the patient with some activities included motoric and maybe social activity. And it's very familiar also in Germany, because most of the people in Germany are working. For example, the children or the partner still working. So the patient still staying at home, but on the day they can visit daily care and spend the time with another people over there, and it's very positive for the social improvement of people with dementia. And there is also name with dementia group. Maybe it's something like apartment, yeah, and this apartment is rent for people with dementia. Of course, not only for people with dementia, but the benefit is they can arrange their daily activity like at home, but they can also get support from another people, for example, from the nurse team. And the benefit of this system is also if we know that the health problem is bad, we can give the best solution as soon as possible. For example, the people or the dementia people can move to nursing home or maybe to the hospital. And I think this one is also very good idea or good solution for people with dementia, because other sides you can start your life as usual, but you can get the support from another healthcare also very, very well. And the last one is, of course, nursing home resident. Nursing home resident, maybe it's really different with like Panti Jompo, yeah, because actually a nursing home resident in Germany, it's like hotel. So only the staff, not a hotel employer, but the staff are nurses, and of course another professional healthcare also. And in Germany, we cannot avoid that the people with dementia at the end of the day should be moved to the nursing home resident, because most of the family cannot cover or cannot give the support for people with dementia at home again. Maybe it's a little bit different like in Indonesia, because in Indonesia, as children, we think, oh, I cannot give my parent to nursing home resident because it means I don't like them anymore. But in Germany, the situation is really, really different, because not because they don't like their parents, but they cannot cover the support system for their parents. Okay, next slide, please. Okay, it's already mentioned before that generally the therapy of dementia consists of medicine therapy and not medicine therapy. So I will explain a little bit the therapy without medicine, because I think there are so many experience I can explain or I can share with you. For example, ergotherapy. Ergotherapy is in Germany very, very familiar, and the cost for ergotherapy is also covered by health insurance. And ergotherapy for people with dementia, we can get it, for example, twice in a week, and ergotherapy comes to the home or to the residence for 1 hour, and they can make or they can give the activities according to the need of the Lansia. For example, just go outside of the house with ergotherapy, or maybe playing some Lego or some playing with the dementia people, something like that. And of course, there is also cognitive training or brain gym, and it's also very, very familiar because there are many research about the positive effect of this brain gym. And there is also behavior therapy, for example, for people with dementia and or plus depression, and it's very, very important also to give behavior therapy. Of course, biography therapy is also very necessary, and music therapy is also very necessary. And we have to look of the patient, what kind of therapy could be present for this patient, and because every people is very different and every people has another needs, and it's very important that we have assessment before, and we can find the best therapy for people with dementia. Next slide, please. Okay, brain gym. So of course, it should be according to the three important elements: body, spirit, and soul, because actually we don't only want to support one element, but also these three elements. And the goals of this brain gym is also improve the concentration, prevent of memory loss, and support of social competence. And otherwise, it support also of motoric improvement and support of the sense. And I think if we give the brain gym for the people with dementia, it's very necessary to keep some principles that it should be present with the patient, and it should be make fun because they have another need as we are, and it should be have a success effect or impact. And we have to see that this kind of therapy can gain long-term memory, and it should be improvement the quality of life of the people with dementia, of course. Next slide, please. I think we are also from the nurse profession, so I think it's necessary for us to know that the strategy for the implementation of brain gym is the first one is the communication. We cannot communicate with the people as like with our friends or with our family without diagnostic dementia, but we have to know that our communication should be short, clear, on command, and it's should we have eye contact. Why? Because it's necessary, because the people with dementia need some people they can trust, and the trust can you build with eye contact. And we have to be patient, because if you explain something or if you give some comment, maybe the patient will not do it as we think, but you have to bring your patient extra, and of course empathy, and you have to give a comfortable atmosphere also. And based on my experience, if I give training for the colleague or the participant from triple win G2G, caring people with dementia is something new for them, because in Indonesia, I think it's new. And in Germany, if they go to Germany, they will find so many people or so many patients with dementia. That's why I give them also some tips or some strategy how to communicate with the people with dementia, because if you don't know how to care people with dementia, it will be very, very hard for us self. Next slide, please. Next slide, please.
Sorry, Mrs. Hani, I think there's a problem.
Okay. Thank you. Okay, as you see, there are many kinds of brain gym we practice in Germany, and Ibu Mariam has give also some examples in Indonesian. I think it's also very, very important to find out what we know and what we can share with people with elderly. And in Germany, there is a regulation from the government that this activity should be apply in our program or our SOP. Jadi benar-benar pemerintah Jerman itu mengontrol gitu ya, apakah terapi-terapi seperti ini benar-benar diplanningkan dan benar-benar dilakukan di lapangan gitu. They are really strong for this therapy because they give so many regulation to support and to give the best life quality of people with dementia. The next slide, please. Okay, so we are on the last slide. In Germany, we say, ich bin nicht verwirrt, ich suche nur den gestrigen Tag. So actually, we are the health workers. We have to understand more about this illness, and we have to know how to care people with dementia, because people with dementia cannot understand our word again. That's why here we call ich bin nicht verwirrt. It means I'm not confusing, but I'm just looking for the last day, something like that. Okay, that's the presentation I can share with you. If you have a question or something from my experience, we can share in the next session. Thank you.
Okay, thank you, Mrs. Hani. I will conclude some of the matter of you. So for the dementia is a complex condition who can affect young and old people. And based on data from Germany, there's a 45.4 million from 65 years old people who have dementia. And in Germany, the healthcare system for patients with dementia, there's a just take care of themselves or requires a private nurse. And for the therapy in dementia can be done without drugs, such as ergotherapy, which can be done twice a week, such as playing Lego. And their strategic implementation is with communication, which gain trust with eyes contact and also give empathy. Okay, the next session will be discussion session. So for the audience want to ask a question, please send your question via chat Zoom or YouTube chat room. Or if you want to ask directly, please raise your hand. All right, there's a first question from Rika. So what about the Indonesian government policy? Is it possible to apply everything that Mrs. Silalahi has explained in Indonesia? All right, Mrs. Hani, you can start to answer.
First, I have to say that in the last years, there are so many improvement or improvement to subject elderly and especially elderly with dementia. Because if I compare to my study time 23 21 until 25 in Jakarta, I have no connection with people with dementia, because people with dementia, I think at the time still stay at home, and the family forbidden to go outside, something like that, and they don't have a professional care system in Indonesia. But with the time, IPGRI is also born, and the subject with I think jurusan-jurusan keperawatan gerontik juga sudah banyak gitu ya. And in the hospital there is also department for gerontology or gerontic. We call it gerontic. It means for me, the people or the government in Indonesia has realized that the social problem or health problem in the next year is people with elderly, and especially people with dementia. That's why I think it's the first step already in Indonesia to make this topic important. And I think it should be more socialization or education in our public, for example in the school, for example in the university, and even it's in our life sociality, maybe di kehidupan arisan atau perkumpulan kelurahan seperti itu ya, because I think this problem is not only government problem, it's our problem, it's a sociality problem. That's why I think it's very important. That's why I think it's very important to educate our people, our social system, that there is new problem in our social system, and it's people or elderly with dementia. And what's dementia? It should be more education about this, I think. So we will not surprise if we find our grandfather or grandmother suddenly with another cognitivity problem. I think that's the first step.
All right, thank you, Mrs. Henny, for the answer. Now I will continue. All right, so this is from Suyanto in Indonesia. How to overcome obstacle if elderly using the app is known that they are over 50 years lack of technology? I think this question's for Mrs. Mariam. Yeah, Mrs. Mariam, you can start to answer.
Okay, thank you for the moderator. Thank you for Mr. Suyanto from Poltek Solo, right? About the question. Based on my application, the purpose of this model, Fiducia RSM, based on Android for the families who care for the elderly. And the criteria of family is having a smartphone, right? Based on data in the previous slide, that almost 96% family in my research is have a smartphone. So the family can accompany the elderly to open and view the app. how to click the menu in the app and doing guessing a game that is with family. I think based on in 2021 for the theme of International Day for Older Person from WHO. The theme is about digital equity for all age. I think the elderly now have technologically literate to open the application and using the smartphone with the family. This is our challenges too, I think, for the support the elderly who lack of technology. Okay, I think enough for the answer, Jessica.
Okay, thank you, Mrs. Mariam. All right, I will continue. Oh, so this is from Iron Susanti. Is there any special programs such as nursing care when elderly have to stay at hospital? Because many elderly mostly doesn't have any family to take care. Thanks. Okay, this is questions for Mrs. Henny Silalahi. You can start to answer, Miss.
Yes, we have a program for this condition. For example, if someone if someone have to stay in hospital, the elderly, they have to get the program, geriatric program. It's called geriatric program. It's contain, for example, the neurological assessment and also therapy from the doctor. And the doctor is also not the general doctor or internist, but it's a doctor, gerontologue with a specialization, for example, in dementia or elderly, something like that. And then the elderly will be stay in the hospital minimum for 3 weeks. So in this time, we can improve the motoric and another items, and we can give the support, for example, ergotherapy, physiotherapy, because maybe the elderly case is fallen from the house, and then we have to support the motoric system again for example, for walking or for standing again, something like that. And if we see that this elderly after 3 weeks cannot go home again because there is no support system at home, no family, no children, something like that, the elderly will go to the resident, for example, and the health workers will organize everything. For example, looking for the best or the right panti lansia gitu ya, and then to contact every stakeholder to make the decision, and all the cost for staying in panti lansia will be covered also from the government in Germany. For the case that the financial support is from the elderly, tidak ada lagi gitu ya, the government will cover all the costs for this case. So I think it's a very, very impressed to know that the elderly in Germany will be not helpless at the end of the time, because they have also another choice to say in the residence or another place, something like that. Ya. Jadi pada akhirnya mereka itu tidak terlantar, lansia-lansia itu tidak terlantar gitu. Ya.
All right, thank you, Mrs. Henny. I think there's a participant who want to ask a question for Mrs. Sri Susanti. You can start the questions.
Hello, thank you, Jessica, as a moderator. Good afternoon from here. I'm living in Southeast Sulawesi. Hello, Dr. Mariam, how are you? And Ms. Henny. Okay, thank you very much for the opportunity. I would like to ask Dr. Mariam first regarding to the application. This is very interesting. Both of the speaker today give us the more interesting about the topic. So I'm curious to the application from Dr. Mariam give us, because I tried to search using my app store and I cannot find them. So is there any possibility to improve this application, not only to Android, doctor, because some of us, like a researcher or lecture, it's a very difficult to use. Some of us, like me, I use the application like App Store or iOS. So maybe any chance little bit to improve this and using iOS. Maybe this my question to Dr. Mariam. And then the second question to Ms. Henny. How are you there in Germany, right? Yeah.
Germany.
You know, it's a fall season there. So, Dr. Henny, Ms. Henny, I want to ask, is there any specific characteristic difference between older people who live in Germany and Indonesia? Because like in Indonesia, most of all, like us, like me, I'm a child from my parents who are older adults right now. So is there any difference? I don't know, it's a belief or fight, but like me, if I want to give my mom to the panty, right? The thing is like I'm not good child for my parents. So how about this culture? Is there any specific characteristic, and then how to manage it if there is any a different perspective there? I think this for my question. Thank you very much. Thank you, Jessica.
Should I begin the answer?
All right. Thank you, Mrs. Sri Susanti. For Mrs. Henny or Mrs. Raden Siti Mariam, you can start answering if you
So I
ready.
forget the question. Yes, I think it's there is a difference between this country. To answer this question, maybe I will start why I don't give my parents to panti lansia. If I compare the panti lansia between both of the country, maybe the answer, because I know if I give my parents to this panti lansia, they will not give the best care I imagine. That's the answer. Because if I compare what kind of panti lansia we have here in Germany, it's like hotel. Maybe they live better in this panti lansia than with me at home. Because in this panti lansia, there are so many kinds of professional health workers, from doctor, nurses, and nurses with gerontopsychiatrische competition also, something like that, and ergotherapy, physiotherapy. Okay, they are not in this panti lansia, but they come from outside. It's mean we can order ergotherapy, physiotherapy to come to panti lansia, or something. Even if my parent has diabetes mellitus and the therapy, for example, insulin subcutaneous or injection, they can make sure that this therapy will be really implemented in this panti lansia. Maybe you can correct me. This is the imagination I seen more than 10 years panti lansia in Indonesia. I only know panti lansia, some panti lansia in Jakarta. I see how the peoples over there go around without controlling, without therapy, without activity, without program. How can I give my parents over there? Maybe I will say, okay, it's better I take some private nurse at home so I can control this therapy every day. So that's the answer is, I think the government should be make a plan, a professional plan for the people with elderly and how they should believe in the panti lansia in professional form, because our population, our demography is also moved like in Japan, like in Japan or like in Germany. Or the younger generation like us, we have to working, we have to finance our daily living, so we cannot like octopus for the parents, for the children, for our jobs and something like this. We need a trust for the government that okay, if I give my parents to panti lansia, it doesn't mean saya anak durhaka. No, it means I have trust with this institution, because this institution is also controlling by the government. That's, for example, the thing. I work in the quality management. So my job is I make sure that the people in panti lansia have a good healthcare system and good benar-benar yeah, they live very good over there. So if we then give the best quality or the SOP quality, we have a consequence from the government. Maybe the panti will be closed or something like that. Maybe that's the answer. And then step by step, we have, as I told you already, we have to make the subject elderly in our socialization system in. Tema menua itu harus keren. Karena itu bagian dari masyarakat gitu. Kita right now is our parents, but the next one we are turn. So I think elderly is ein subject. We have to go to the public and introduce them. Hey, what is dementia? How, with which system or which symptom has a dementia, something like that. Thank you.
Okay, thank you, Mrs. Henny. Maybe Mrs. Mariam can start the questions.
Okay. Thank you, Nurse Susanti. How are you in Makassar?
I'm good, thank you. Alhamdulillah. Hope you
Okay. Yeah. Your question is the same for another colleague in about my research. This is advice and recommendation to the next project with based on IOS and of course in the next project, my project in the fellowship of postdoctoral program, is about how to make the application to detect early detection of dementia, and based on Android and iOS. For now, the app, my application is for the based on Android. Thank you for your advice, Nurse Santi. I hope that is a small effort for me, and maybe can be meaningful and useful for all the community, especially for the family with the elderly, how to manage risk factor of dementia. And we want to and we don't want to in the 2030 we are all the part of the prevalence of dementia. Thank you, Dr. Santi.
All right, thank you. Because of the time, we should finish the discussion session, which was conducted by Mrs. Mariam and Mrs. Hani. Or I will conclude this discussion session. So we get a lot of things about applications for the elderly that are very interesting and interactive, and how the elderly in Germany are very concerned by the government. And we now have a different views on the elderly in Germany and Indonesia. So thank you to Mrs. Mariam and Mrs. Hani and all the audience who asked questions too. So the next is the handover of certificates to our speaker, which will be delivered by Mrs. Niluh Putu Ekarini, SKEP MKEP, SPKMB, as a head of Applied Bachelor of Study Program, Department of Nursing Health Polytechnic Ministry of Jakarta 3. To Mrs. Putu. Okay, how are you?
Okay.
All right, Mrs. Putu is welcome to give the certificate.
Okay, for the second session, thank you, Dr. Raden Siti Mariam, SPCOM, as a speaker for sharing the material at the International Seminar of Health Polytechnic Nursing Student Jakarta 3, and please accept the following virtual certificate as a speaker. Thank you, Mrs.
Putu.
Mariam.
Thank you. Don't forget for all participants to install the My App in the Play Store now. Thank you, Ms. Putu.
Okay, Mrs. Henny. Thank you, Mrs. Henny Silalahi, as a speaker for sharing material at the international seminar. And please accept the following virtual certificate as a speaker. Thank you, Mrs. Henny.
Thank you very much for having me today.
All right, thank you for Mrs. Putu. That's all from me. I apologize if there's any wrong with my words. So I hope you all can enjoy the rest of the event. Thank you so much, and I will return to the MC. Thank you.
Thank you, Jessica. Thank you, Miss Henny.
Thank you juga, Bu.
Thanks and appreciation to Jessica Astuti Pereira for guiding the second session. Also to Mrs. Henny and Mrs. Mariam, who has shared a knowledge and experiences that are very useful for us.
The next is symbolic awarding of certificate of the moderator, which will delivered by Head of Applied Bachelor Study Program Department of Nursing, Health Polytechnic, Jakarta 3, represented by Mrs. Niluh Putu Ekarini, M.Cup, and S.SP Cup MB.
Okay, for the last certificate, thank you, Miss Jessica, as the moderator in the international seminar, and please accept the following virtual certificate as the moderator. Thank you, Miss Jessica.
Okay, thank you so much, Mrs. Putu.
Thank you for all both of you, for Jessica and also Mrs. Putu.
All right. Ladies and gentlemen, this ending the main event of the speaker's presentation, but participants are expected not to leave the Zoom meeting because at the end of this event, there will be a games and door prize announcement to some lucky participants.
So now we are going to next station, that is ice breaking and door prize. So for the committee, you will start the games. Okay, for all the participants, you may open the quizzes application on your smartphone or on your laptop. Okay, so here's the code of our quizzes for today. For all of the participants, you may enter the code on the quizzes application.
And the winner of these games, there are one of this participant that answer as many as possible correct answer and the quickest, of course.
Okay, we're still waiting, eh? Okay, come on. Okay, all the participants have to join this because there is a door prize, yeah?
And for a little spoiler, these games is about all this seminar. Yeah.
Yeah.
You can join the quizzes with the code on your screen right now. We're still waiting for you.
Okay, we're still waiting, yeah, guys. You can join right now. If there are any problem, you can contact the committee, right?
Okay, we already have 60.
Wow, that's a lot of participants joining this quizzes, right?
Okay. We're still waiting on you. So please join the quizzes with the code on your screen right now.
Okay, we're still waiting.
Okay, we announce again to all the participants, we're gonna start at 12:30 and it's 1 minute remaining for all the participants who haven't joined. We please join these quizzes because there is a winner that can win
Short price?
their prize.
Yes, that's right. Okay. Okay, are you ready, guys? We will count down from 5, 4, 3, 2, 1.
Let's start the game.
Yay.
Okay, for the first questions.
Oh, this we know about this question, right? Elderly health service through digital healthcare is delivered by Ibu ya.
Raihan, I know the answer.
Yeah, so
But
of
you can
course.
say this.
Yeah. Keep it secret.
Okay, for all participants who have joined these quizzes,
Please
give your answer.
choose the right correct. Wow, we know the leaderboard is
Muhammad Naufal.
for the first place. Ooh. Okay.
Component of digital health service, including
What's the answer? Okay.
2 seconds remaining.
2, 1. Time's up. Okay, let's see the leaderboard again. Wow.
Muhammad Naufal is still on the
Still,
ground.
yeah. Wow, still on the
Still on the
first
chart.
place. Wow.
Is there anyone can go after him?
Yeah, of course.
Need third question. Where did the second speaker come from?
Is it come from Indonesia or
Germany?
Germany?
I don't know.
Or maybe Australia. Okay, time's up. And then we see the leaderboard again. Wow.
Ida is so close, Ida.
Oh, yeah.
Fourth question. What is the benefit from digital health?
I think.
You can say this.
Okay.
Okay, 3 seconds remaining.
Mm, mm, mm,
Is Muhammad
mm.
Naufal still on top?
Times. Let's see the result. Oh,
Muhammad Naufal. Wow.
Ihda and Muhammad Catur. Okay, what's that is World Elderly Day. What date? I'm so sorry.
What's the date?
Yeah. Mm, 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 mm. 4, 3, 2, 1, and time's up. Okay, let's see. Ooh,
Oh.
Catur. Yeah,
There's some difference.
yeah.
But Muhammad Naufal is still on top, yeah?
Yeah. It's going to be so interesting game, right?
Is Chatur can go after him?
Yeah, I think yes. Let's see.
Okay, sorry, Naufal. For the 6 questions. What date is Indonesian Elderly Day? Now it's Indonesian.
Yeah. Okay, 1 second. And let's see. Ooh, and now second place by Yuni. Wow.
What is Kedusi RSM?
It is
Something.
Okay.
Kedusi RSM.
Okay, for the leaderboard here. Okay, I think this is
There's
the
no
same like
difference.
before,
Yeah. Muhammad Naufal and Yuni
at the
still
first
on-
and second place.
Yeah. It's 8 questions. In Kedusi RSM application, there is the family and elderly
Menus, yeah.
menus with contents.
I think I know this. Okay. Oh, same like before.
There's still no difference. Yeah.
Yeah, no difference.
Ninth questions. How many items for skills that consisted in logbook?
How many? How do you think?
I can't say this. Okay, 3 minutes, 3 seconds, sorry. There's a little bit difference,
Yeah, Anissa, Sofianti.
but our 3 tops still
Yeah,
in there.
yeah. Okay, guys.
It stands questions. What can all elderly do to improve their cognitive functions?
Ayo, come on. Let's see. Ooh,
That's a big difference.
yeah.
But Muhammad Naufal is still on top, yeah.
Yeah. I'm really proud of him.
Is he your friend?
Yes, absolutely.
How's question? 11th. What's the name of speaker from Germany? From Germany.
She's the most beautiful, right? The most beautiful speakers.
And the others was
Yeah.
beautiful. So
Yeah.
1 second.
Okay. Let's see.
And
Ooh.
there's a
Little bit,
different, but
yeah.
our three top still on the
Yeah.
ground. Yeah.
Let's continue to the next question. What is the name of this
What is the theme of this 2023 international webinar? Okay, what our theme? Yeah,
Yeah.
we
That's
already mentioned it
already-
before.
Yeah.
A lot. We mentioned it a lot. Okay. 10 seconds remaining for all the participants. Give your correct answer.
3 question remaining, yeah.
Okay, let's see. There's a big difference.
Yeah,
Okay.
yeah.
I think Muhammad Naufal is already. I think he is always on the
counter.
screen. Yeah. Yeah.
No counter.
For 30. How many speakers did the international webinar have? Oh,
So many speakers.
there's one session and second session.
Yeah. So many, yeah.
Okay. 5 seconds.
This is the last question.
No.
No. Okay.
Let's see the
We still
leaderboard.
have one, yeah. One question left. No difference.
Okay, no
Yeah.
difference.
No
Muhammad
difference
Naufal
for
is
with
the-
the leaderboard. Okay, this is the last question.
I think there's one more.
Oh, one more. Okay, guys.
For this 14, what are the burdens caused by BPSD? What is the burdens?
I think
Okay, 5 seconds to all the participants to give it the correct answer. And let's see the leaderboard.
Ding ding ding. Ooh. Yeah.
Okay, for our last questions.
Last question.
Anti-
Anti-dementia drugs including. It is from our first session, right? With the doctors.
Bukovisa.
Yeah, Dr. Bukovisa.
Okay, 10 seconds. Okay, let's see who is our winner. And the winner is
Ding 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 ding. Okay. Ooh.
okay, Muhammad Naufal is the winner.
Oh. Big appreciation for Muhammad
Naufal. Okay,
Naufal.
but before we announce all the winner,
Yes.
the committee needs 5 minutes to choose all the winner and at all the category. So please wait for 5 minutes, yeah.
Terima kasih Bu Raden. Bu Rene. Ibu moderator, panitia semuanya makasih ya. Pak Paulus, terima kasih.
Thank you, Mr. Aceh.
Alright, thank you. Yeah.
Okay, so now we're gonna do announcement for all the winners for all the category. For the committee, please send the winner.
Okay, this is the first category for the door prize Kedusia RSM. This is sponsored by Alzheimer Indonesia Regional Bekasi. The first winner is Aisyah Arifah, Amatunisa Citra Salsa Khairunisa, Gelvira Setia Ningtyas, Kansa Fitria Mutia, and Jihan Laila. For the door prize winner, you can contact the contact person that you can see on your screen.
Congratulations. Yeah.
Congrats.
And for the next category, door prize winner for best question is Hana Erista. And for the most active participants, Rika Enda. And the highest quiz score, Muhammad Naufal. For the week, you can contact the committee at their screen and claim the prize. Congratulations. Ladies and gentlemen, participants in the international seminar, before the event ends, we will do a documentation session. All participants of the online international seminar are expected to activate the camera. We're going to do a documentation from page 1, 1, 2, 3. Next, for page 2, put your big smile. 1, 2, 3. For the next, page 3. 1, 2, 3. Okay, we're done. Thank you all.
Thank you all.
Okay. We would like to kindly remind all the participants fill in the final attendance form in the chat, Zoom, or YouTube comment column. Thank you for all participants for joining in this event from the beginning to the end. I hope the knowledge from our speaker today can be useful for all of us. We generally apologize for there might be any mistake or lacks. We hope that we could meet in the next international seminar.
Okay, we are Satrio and my partner
Royhana
as the Master of Ceremony of this seminar, checking out. Thank you for your attention. Wassalamualaikum warahmatullahi wabarakatuh. Good afternoon.
Waalaikumsalam warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
See you on the next event.
Bye.
Bye.
Terima kasih semuanya.
Thank you.
you.
for all the committee. Great.
Yes.